Hola, les damos la bienvenida a la
Hi,
segunda
and welcome to the second part of our fourth day
cumbre mundial
for our second World Summit
tradicionales y
on traditional and complementary medicine towards an integrative medicine.
Este cuarto día se ha
This
abordado
fourth day,
implementación
we had and we are working around implementation
de las diferentes regiones.
of MTCIs.
Muy interesante y seguiremos con este interesante
It's been a really interesting day, and we'll continue with this interesting path and deepening of knowledge. During this afternoon, we'll have a conversation, and we've already had Asia and the European region, and we'll carry on now with how was it organized and how MTCIs have been organized in the region
en Norteamérica y en Centroamérica,
and in North America
con experiencias
and in Central America.
de Sudamérica.
Then we'll carry on with
Posteriormente,
experiences from certain countries from South America, and we'll have also the experience of integration to some health systems, like the Logan Center from the University of Harvard and in the J. Anderson Cancer Center. And to finish this afternoon, we will be sharing an experience of all of the knowledge of Dr. Alex Ariano and Tabata Partin,
compartiendo su experiencia sobre salud de nuestro entorno, del medio ambiente,
sharing their experiences in environment,
comunidad, diversidad e inclusión y cuál es el aporte de las MTCI.
unity, diversity, and inclusion, and what are the MTCIs in this global health.
Tengo el honor de presentar y de introducir al moderador del siguiente panel, el doctor Hernán Rodríguez González.
I'm honored to introduce and to present the next host for our next panel.
Quien es médico cirujano especializado en epidemiología.
Is a surgeon doctor specialized in epidemiology with a master's in public health. Dr. Rodriguez is a consultant of health systems of the World Health Organization Peru. Please, Dr. Rodriguez, welcome. You have the floor.
Gracias, doctora Cecilia, por la presentación. Muy buenas tardes a todos y a todos. Bienvenidos.
Thank you very much, Dr. Cecilia, for that presentation. Good afternoon. Welcome to this third day of panel.
Organización, implementación y
And
gestión.
as you mentioned, we'll try to go in towards integrative and complementary medicine, and that's why we're going to have a participation of North and Central America. Please, we are going to share with you the main goal of this session, which is precisely to spread out the message and
Recording
the
in
experiences
progress.
of implementation, of organization, management, as I've mentioned at the beginning, in these two regions, Northern and Central America.
La participación de
We have the
cinco
participation of 5 panelists, and I'm going to be making a presentation of each one of them, really specifically, so then we can start our presentation of each one of these panelists. We would like to let you know that each one of them, we have 20 minutes for each session. I'll give them a nice reminder once we get into our time limit. And at the end, please, we encourage you all to write down your questions, and hopefully we can have space for a couple of questions at least and get to some final conclusions. So I'll do this presentation of these five panelists. First off, we have Dr. John Finner. John Finnell is the manager of the Wholesome Research Center. He works in the South Texas University School. Dr. Finner is an acupuncturist and naturopathic doctor. He has a master's in public health from the George Washington University. And he still is a candidate for the PhD in epidemiology at the University of Texas School of Public Health. Next one, please. Our next panelist is Dr. Alejandro Maguer Gonzalez. He's a director of traditional medicine and intercultural development of the Health Secretariat of Mexico. He's a doctor as a profession and a healer by heart. This is a really interesting approach. He has a master's in administration and management of hospitals from the Mexico Autonomous University. He also has a master's in the direction and assessment of public health from the National Institute of Public Health of Mexico and epidemiologist as well. Our next panelist, and in this case, is Dr. Ricardo Cortez Salazar. He's the coordinator of the Natural Medicine Program and Traditional from the Ministry of Public Health from Cuba. His doctor graduated from the Superior Institute of Medical Sciences from the Havana, specialist of natural medicine and traditional medicine, and he has a master's in bioenergetic medicine in natural medicine, and of course has experiences as a professor, assistant, and researcher. Our next panelist
Coordinadora académica e investigación.
is Dr. Maria Jose Mendoza. She's the director of the Natural Medicine and Therapy Institute for Complementary Therapy from the Ministry of the Citizens Power for Health of Nicaragua. He's natural from Choroteja, original indigenous population, with a master's in public health from the University of Caribbean Coast of Nicaragua. He has also a master's in public health in the Research Center and Studies for Public Health in Managua, and a licensee in nursing. We also have Dr. Marita Ruiz, the academic coordinator and of research from the Natural and Complementary Therapies Institute. You can see a wide range of experience from the Natural and Complementary Therapy Medicine Institute. She worked at the Health Ministry of Nicaragua, research and academic coordinator, phytotherapy teacher with a diploma in articulation of traditional ancestral medicine and a diploma in specialization in diabetes from the Autonomous University of Nicaragua. We also are welcoming Dr. Giselle Letelier, who is the director of the Division and Direction for Pharmacy, Medication, Traditional Medicine from the Ministry of Public Health of the Republic of Haiti. Dr. Letelier has a master's in public health and has been the director of Pharmacies, Medication and Traditional Medicine of the Ministry of Public Health and Population of Haiti since November 2017. And in 2019, she joined the faculty of the Medicine and Pharmacy faculty from the University of the Haiti State to start her work as a teacher. And with all this information, we'll start our first presentation from Dr. John Fennell.
de implementación de servicios de las MTCI en los hospitales de veteranos de Estados Unidos. Adelante y bienvenido, doctor Finner.
Please go ahead, John.
Inventarme esta conferencia importante. Welcome everyone back to the afternoon session. My name is Dr. John Fennell. I am the program manager for whole health at the South Texas Veterans Healthcare System in San Antonio, Texas. And I'm going to be speaking with you today about the dissemination and implementation of the VA whole health system of care here in the United States. Next slide, please. So just to start, remembering the definition of health as defined mental and social well-being, and not merely the absence of disease, and that the enjoyment of the highest attainable standard of health is one of the fundamental rights of every human being. And when we're thinking about health and well-being with that definition, it really it begs us to think about healthcare with a broader vision as well. Next slide. And so here at the VA, there's a broad overarching initiative to transform the culture of healthcare within the VA system, focused on our veterans, also on employee health, as well as the health of the community. And whole health is defined as an approach to healthcare that equips and empowers people to take charge of their health and well-being and live their life to the fullest. And so what we're really trying to do is change that conversation about healthcare from what's the matter with you to what matters to you, and to really focus on helping our veterans develop health goals that help them achieve the things that are important to them in their own life. And then helping them develop the skills in order to achieve those goals. Next slide, please. And so the whole health system of care, we have two ways of looking at the system. And the figure on the left shows, and the right, both show community as an outer circle. But I want you to think about community as really being the foundation of the whole health system of care. And then with that community that's supporting healthful living, then we're going to need the healthy environments, healing relationships, and then in the pathway we start focusing on partnering with our veterans to discover what is really important in their lives, so their mission, aspiration, and purpose, and begin to create health goals that are going to help them achieve those goals within their own life. And a part of achieving those goals is to really equip them with well-being skills. And our well-being skills, we could think about diet and lifestyle, but it could also include exercise techniques such as yoga or Tai Chi. Many of our traditional health systems have practices that are engendered within them to encourage self-care throughout your lifetime. And so making sure that all of our veterans have the skills and the knowledge base to take charge of their own life and health is really important in the focus of the whole health model of care. And the third petal is clinical care. And so the clinical care includes both our conventional approach to healthcare within the VA, but is also incorporating some of the traditional and complementary health practices, such as acupuncture, massage therapy, yoga, tai chi, mindfulness meditation, hypnotherapy, biofeedback, among others. But it's really, again, focused on making sure that the veterans have all of the tools in their toolbox to achieve whole health. On the right-hand side, we call this the circle of health. And again, community is the foundation. And we're combining our preventative approaches to treatment, but also our complementary and traditional health practices. But the veteran center. And so the me at the center of this figure is about the veteran, or it could be the employee, or it could be you. And so having mindful awareness about your own health and why it's important to you, and then looking at different aspects of your health, such as your surroundings, by recharging and relaxing, your family, friends, and coworkers, spirit and soul, and power of the mind, effects of whole health and well-being. Next slide. Difficulties.
Okay.
So the implement. Let's see. Can you hear me now? I'm back. Okay. Apologize for that. The implementation of the whole health system of care is a very complex and long process. It will take many years to move the VA from the current system of care to a whole health system of care. And so with this implementation, it's going to require infrastructure development, working on marketing and communication, implementation of the core components of the whole health system of care across all of the service lines, including primary care, mental health, and specialty services. And that is already happening at the flagship sites. And again, the South Texas VA is one of 18 flagship sites around the United States that is leading this effort. But it also includes this transformation will take place at other sites within the VA as well. And again, moving through the implementation, we are just finishing year 3 here at South Texas and moving into the integration phase, which will be integrating the components of whole health system of care through all of the departments within our system. And that's going to include ongoing training and professional development. And for many of them, they have not had acupuncture as a part of the offerings that they can provide to veterans as an example. But there are a lot of other services within the whole health system of care that may be new to different professionals. And so it will take an interprofessional approach to achieve this aim. And then the last piece is the transformation phase, which is that all sites and care of care and service lines are using a whole health approach. And that doesn't mean that they're all using the traditional and complementary health practices, but rather they're focused on changing that conversation with the veterans from what matters to you. And so we are working this transformation across the VA here at South Texas again. Next slide. And so there are different categories of the whole health system of care. One is the core offerings, which include personal health planning, peer-led whole health groups, pathway services, working with health coaches, and educational groups. And this is really focused on, again, that well-being skills building, the empowering and equipping of veterans to take charge of their life and health. And so we're very much focused on ensuring that the core components of whole health are adopted by all parts of the delivery of care within the VA. And then there are list one complementary and integrative health approaches that are also included. And those include chiropractic, massage therapy, acupuncture, both full body and auricular acupuncture, yoga, tai chi, guided imagery, and hypnosis. And these were chosen because they had a robust amount of evidence to support their use in the VA for a number of health concerns. And so the VA is starting with these therapies to integrate within, but as more of the evidence base develops about other traditional and complementary medicines, we can expect that this list may continue to grow. Next slide, please. And just thinking about the whole health system of care and the quadruple aim, many of you may be familiar with the quadruple aim, but really focusing on the patient experience, a population health approach, so addressing the social determinants of health as well as clinical concerns, reducing costs, and the well-being of our care teams. And so also focusing on the well-being of our employees is going to be important in the implementation of a whole health system of care and the transformation of care within the VA. And next slide, please. And so to achieve this quadruple aim, here at South Texas VA, we have created a model of care which really focuses on those different petals within the whole health system of care, the pathway, the well-being programs, and clinical care. To really, again, we're going to work with veterans to identify their own health goals. But then really focus on empowering and equipping them to achieve those goals. And we do that by starting with introductory classes, which may be focused on a petal within the circle of health, such as and things, and helping the veterans develop well-being skills with respect to that part of the circle of health. And we have two tracks within that. We have veterans that are on more educational self-care class tracks, but we also have some that are focused on them developing skills for self-management of their disease. And so if we took a pain condition, that might be having a veteran with a low back or knee condition to really work in a class that's focused on helping you develop skills to manage your back pain. And for many veterans, working on their own health goals and developing well-being skills may be enough or maybe it delays the surgery that they might need because they're able to manage their condition on their own. And then for those who do need the clinical care, then we do continue to have our conventional system of clinical care, and we're combining that with the evidence-based delivery of complementary and traditional health practices. The next slide. And so some of our results have shown that for veterans who have developed SMART goals here at South Texas, that there's a predominance of health goals that are around working the body, so physical activity, and also power of the mind, so our mindfulness practices, stress management, and so forth. There's also quite a bit of interest in food and drink, but one thing that I would ask you to do is remember that we're early in the implementation of the whole health system of care, and some of our programming was affected also by the COVID pandemic, and so some of our class tracks are still up and running. So we're hoping to see of the circle of health, such as recharge, relaxation, spirit and soul, and surrounding. Next slide. And again, focusing on that quadruple aim, we're really looking at kind of an integrative approach to care, focused on the health and well-being of the veterans, and a intensive whole health experience means that they've been seen within our program 10 or more times, and the evidence is showing that those who do have that intensive whole health experience, so learning the well-being skills and putting those into practice. And the other thing that the early data is showing is that there's also a reduced cost of care for those that are engaged in a whole health approach. And many of us know that the traditional medicines throughout the world have had that focus on well-being and self-care, learning how to prevent the need for higher force interventions. Next slide, please. And I just kind of want to bring us back to some of the programming we have for employees. And so we really are focused on employee whole health. And so in South Texas and across our region, which covers most of Texas, we've worked on developing shared resources for employees to also engage in well-being activities such as mindfulness or yoga, Tai Chi, and cooking classes, as well as we've been able to roll out some resources like mobile phone-based applications and other web-based applications for employees to explore their own health and wellness goals. Next slide. And what this is going to take for this cultural transformation of care is interprofessional and collaborative practice. And I just want to encourage us all to think about there are many different provider types that are going to be engaged in this process. And so as we're going through this, it is going to take everyone working together to make this transformation a reality. And I'll go on to the next slide, which kind of shows those the core competencies for interprofessional practice, which include teams and teamwork, understanding each other's roles and responsibilities, really standing behind our values and ethics and the delivery of this whole health system of care, And I think, go to the next slide, please. There we go. And it's really going to need to focus on that interprofessional communication. And so again, this is bringing in complementary and traditional health practices into the VA and different provider types that have never been a part of this healthcare system. And so we're really working hard to make sure that all of our providers offering the new services such as traditional and complementary medicine are integrating well with all of the other conventional healthcare services. And we'll move on to the next slide. And I'll just wrap up with our progress report. And this is available online at the following link. But what we are seeing is that there is an increased change of the organization through a lot of education on the whole health system of care, that it's moving the needle for our providers, adopting kind of this new culture of the delivery of healthcare, that they're also engaged in working on their own health goals and hopefully leading to veterans are really engaged in whole health and adopting this new system of care. So we're seeing increased employee satisfaction and decreased burnout, but also our veterans are seeing great outcomes, for instance, with decreasing opioid use for the management of pain, among other things. And this process, again, the implementation for the whole health system of care is going to be a long-term process. And it is getting national support for us to make this transformation. And I'm very hopeful that we will be able to equip our veterans employees to take charge of their own life and health and achieve their health goals and live a long and fulfilled life. So thank you so much for your time and attention today. And again, we appreciate your attendance. Thank you.
Muchas gracias, doctor Finner, por tu tiempo, ¿verdad? Medido.
Thank you very much, Dr. Phil, for your time. It was really timely. And now we open the mic for Dr. Jose Alejandro Almaguer Gonzalez, that's going to help us to introduce the experiences of implementation of the MTCIs in the health services of Mexico. Please go ahead, Dr. Almaguer. Good afternoon. I'm about to share my screen with you. If you'll be kind enough to wait for me and let me know if it's okay.
Sí, se ve, pero por
Dr.
favor.
Hernan, can you see my screen? Yes, we can see it. Please put it on presentation mode. Thank you. Yes, that's what I'm trying to do. Okay, it's done now. Thanks for this invitation. Hernan, you can interrupt me whenever I go too fast, okay? I have seen the former lecturer and he was paused. I mean, he had a good pace and I could understand well. I'll share with you these experiences on implementing traditional, complementary, and integrative medicines in Mexico. First of all, and I remember this with lots of pleasure, when we got the authorization to have a national program on traditional, complementary, and integrative medicine, we started with 2 national consultations and we received incredible response. The room of the National Medical Center addressed to traditional practitioners and indigenous midwives, and the other one, those who did complementary therapeutical practices. Yeah, We had to start this way, and we were born in August 2002. Never before, formally, even if there were extraordinary works done in Mexico, for example, since 1997, after the Alma Ata meeting, there are three categories of medicines in our law: allopathic drugs, herbal drugs, also called herbal remedies, and homeopathic drugs. That's something others did. And what we did was to keep them prevalent. So we had a national survey to see what other models and therapeutical practices there were in Mexico. We found 195 practices, most of them outside the legal framework. 191 were outside the legal framework. So allopathy, homeopathy, and herbal medicine in its contact with indigenous medicine were included in the legal framework. Therefore, we had to propose for the Mexican healthcare system a validation model to identify the contributions and risks of other models and to incorporate them to our service supply. Fortunately, under these criteria in the healthcare law, safety, proven effectiveness, cost effectiveness, adherence to ethical and professional regulations, and social security. We started to try to implement all these models. Traditional indigenous medicine and indigenous midwives were thus promoted together with other clinical models. We had to propose specific service infrastructure in building hospitals, doctors' offices, spaces for other models. So we were able to use other medical therapeutical models for an acupuncture office, for example, for an homeopathic office, and also in indigenous medicine. We changed the environment where doctors and indigenous midwives collaborate. Those models were incorporated to the healthcare infrastructure plan that has been adopted. Also humanized, safe, and intercultural approach for treating women. I'm very happy to say that we redesigned the delivery room and the birth room. As you can see, this is the way in which women give birth, and we coordinated that with the National Council of Technological Excellence in the Health Secretariat. It was not totally vertical. It was 45 degrees, and boys and girls come out very easily. The best way of giving birth is what women all over the world invented along history. So I'm very glad about this. We have to identify specialists, acupuncturists, doctors, technicians on acupuncture. We also have nurses and other technicians, homeopathic doctors and specialists on herbal medicines, and we were able to open spaces for healthcare. We opened acupuncture spaces in other hospitals. We have 4 systems in Mexico. The workers system, the bureaucracy system, that's how it is called, 7 million inhabitants. The factory workers system, 50 million. And then that is the National Social Security Institute plus private hospitals and health secretariat hospitals, and we have incorporated them all little by little. And fortunately, we have been able to demonstrate the extraordinary contributions of other clinical models. We had to have specialists participate in homeopathics, herbal medicine, and acupuncture. They participated in the so-called basic frame committees. We started with homeopathy, then we went to acupuncture, and now we're into herbal remedies. We had to start research. We had to guide it to offering these therapeutical medical models. And well, we want to validate them, and researchers have to help us to verify proven effectiveness, safety, cost benefit, timeliness, etc. Regional interinstitutional committees for human resource training did contributions for research, and we had to guide teaching in a different way through public policies. In complementary medicine, there are four basic elements. First, we have the society that aspires to other therapeutical models, and then we want a legal framework for them. So we first identify the model, its scope, research, teaching, and service. Originally, I heard the person who spoke to us before about how to approach other models to people for their well-being. And we proposed this model. It was called love, food, exercise, and good humor. And then we added other things like work, for example. We made some strides also with friendly hospitals. There's sadness and pain in hospitals, and we want to change that. We want hospitals to be friendly, not only with the sick people who are hospitalized, but also with their workers. We also want to have open spaces, good humor, music, theater, dancing, cinema, table games, board games, stories and legends, narrations to prevent violence, to prevent stress, improve emotions at family and community level. I'll go a little bit slower now. Making strides. We prepared an intercultural model for integrative medicine. This path has not been easy. There has been an intercultural crash between the conventional and the traditional models. And this happens all over in Latin America. I visited all countries in Latin America, and also I will soon visit Haiti. I'm glad we have a representative from Haiti. So this intercultural model for integrative medicine is being accepted little by little. We have acupuncture for diabetes, for injuries, for pain, for other diseases. We have contributions for healthcare, public healthcare, addiction, not only with acupuncture. We can tell you about studies we did in jails in the north of the country. Those people without that were deprived from their freedom did not continue consuming drugs, and we did homeopathy against cocaine consumption. We had homeopathized cocaine, and in this way we prevented delirium tremens, and we had relapsing of no more than 20%. These are extraordinary contributions for these problems many countries like Mexico suffer from. As for integrative health care in hospitals, we had contributions from other clinical models, and then we focused on diabetes. This is our model for diabetes. There's a great opportunity there, and I'm very glad to see with our own eyes when we can dream and go ahead. Besides allopathy, there are other models that help us on a daily basis. I mentioned this before. This is the pain clinic with acupuncture, taking care of the elderly people. We have to remember this always. Beyond 65 years of age, elders have drug baggage. They have like 20 drugs that they have been given, and those have collateral effects. But with this kind of medicine, there's no more expenditure for their pockets and no drug baggage. They have cost-effective possibilities. So there's a lot of cost contention, and it's strategic then for countries such as ours. Taking care of caregivers. This is the most recent. As from May last year, with this pandemic, we decided to have a model that was called Who Takes Care of Caregivers. So then we decided it was taking care of caregivers. It's based on three essential things: preventive and healing homeopathics, also at least one healthy nutrition menu in one shift. Those that stimulate the immunological system, that nourish you better, and particularly for the pandemic, and healthy exercise, particularly for the respiratory system. What we found is revealing. We have already shared this in other forums concerning freedom of expression in our country. 4 states of our republic started with this model, taking care of caregivers, particularly with homeopathics. And we had a basic scheme of research protocol. It's still pending. It has to be decided by the National Council of Science in the country. Besides that, we had the prevention and caregiving protocol, and now we have a national center of phone guidance. When you come, don't only visit the Zócalo, theater, movies, mariachis, go and see our homeopathic hospital that has almost 100 years of age. I go back to COVID. Concerning medicinal herbs, the people imagine and they seek other models such as herbal medicine, particularly what we have detected in the Iris peoples in Sonora. In the pandemic, as from June 2020, these peoples did not believe there was this pandemic, but then they had 15 cases and they got convinced about that and that they had to take care. And look at this opportunity. The doctor in the only healthcare center in that village got sick. Fortunately, he didn't die. He went out of circulation, and with 4 healers, 3 men and 1 woman, we tried to understand what their practices were. As from July 2020, we have had no deaths by COVID in that village, and we shared that joyfully and disseminated that to other peoples in Mexico. This is a strategy in Oaxaca where we have lots of people and food diversity. 3 health jurisdictions with 11,000 treatments. in the city of Mexico, in a municipality, we do not have them in the federal district, but in the state. We distributed 80,000 treatments beyond nurses and doctors in Querétaro. In all the COVID-19 hospitals, these homeopathic medicines were distributed. Let's take a look at the data. In 2021 in Querétaro, we had a COVID-19 outbreak in personnel who did not take homeopathy. These are sentinel hospitals that were working directly with COVID. In this case, in Querétaro, these were 4 COVID hospitals. An outbreak was detected and 8 people died. In personnel that were protected with homeopathics, only 7 COVID positive cases with mild symptoms occurred. In Oaxaca, those protected with homeopathy did not get sick with the COVID, and they had negative tests. In unprotected personnel, there was COVID and positive testing. So 80,000 treatments in open population in the city of Mexico. I finished with this to give the chance to other lecturers to share their ideas and questions. This woman said in a poem, no matter if the dreams are lies, because in the end, they are the truth. Fortunate those who die dreaming, and unfortunate those who die without dreaming. Thank you very much, Doctor, for your presentation. I'd like to acknowledge the 2 lecturers, and it's a good example for the following panelists and for the other panelists today, tomorrow, and on Sunday, because you are using even less than your 20 minutes, and this will allow to have our schedule respected. So please write your questions, and let's go to the 3rd lecture by Dr. Ricardo Cortés Salazar, who's going to talk about implementation experiences for TCIM in healthcare services in Cuba. Dr. Cortés, you have the floor. We're going to talk about the experience of implementing MTCI in the Cuban healthcare systems and services. I'm Ricardo Cortés Salazar. I'm a doctor at the Ministry of Public Health in Cuba. The background and context concerning MTCI and TCIM in Cuba. TCIM in Cuba is part of our economic and social policies in the country. It is integrated by the healthcare system, the National Assembly, the Ministry of Health, and the national units. All the essential units in Cuba have integrated MTCI. And as I said before, it's part of our economic and social policy. It has been so since 2016, the 6th Congress. The Cuban healthcare system, it has universal coverage. It's a service that every Cuban citizen receives for free. It is accessible for all over the country. It is regionalized, and at the same time, we have integral medical health care. Each citizen can receive care where they want, but they also receive medical health care from any specialist at no cost. Taking this into account, we have to say that TCIM in several modalities have been used in the country a long time, since a long time before the country developed. it comes from indigenous peoples who use the medicinal plants. Then it was developed through the studies made by Freud, that studied the medicinal and aromatic plants in Cuba. He introduced homeopathics, and the Cuban Revolution officialized the use of acupuncture. There were a number of decrees afterwards that ruled the use of traditional, complementary, and integrative medicine. Since 2015, we have legislation that regulates natural and traditional medicine in Cuba. These modalities, as you will see in the resolution, when you read it, you will see that it allows, through research and clinical trials, to approve new modalities. And that's covered by this resolution. In this resolution, we adopt the natural and traditional medicine as a medical specialty in the same way as other specialties. It is a medical specialty that is integrative and holistic concerning healthcare problems, that uses methods to promote healthcare, prevent diseases, diagnose them, treat them, and rehabilitate patients from traditional systems and other therapeutical modalities that are integrated among themselves and with Western medicine. In 2015, we adopted this resolution, and we had 10 modalities: acupuncture and similar phytotherapy, epitherapy, homeopathics, floral therapy, traditional therapeutical exercises, ozone therapy, medical hydrology, heliothalassotherapy, and natural nutritional orientation, plus Ayurveda, that was adopted as a new modality in Cuba. How do we integrate the natural and traditional medicine in healthcare? As I said, it is considered as a medical specialty. We develop specialists in this kind of medicine. Once the persons finish their medicine studies, they become medical doctors, and they start their specialty in TCIM. This is a specialty that lasts for 3 years. It's developed all over the country. All the provinces in the country are authorized to develop the TCIM specialty. The other way in which doctors are trained or learn this knowledge is through integration of natural therapies in different curricula in different medicine specialties. Thus, we have that the natural and traditional medicine scenarios in medical healthcare are at these levels: tertiary level, secondary level, and primary level. In tertiary level, we have services, departments, and offices for natural and traditional medicine, like in the Gastroenterology Institute, Endocrinology Institute, International Center for Neurological Restoration, etc. At secondary level, we have provincial reference services in services, departments, offices of natural and traditional medicine. And we have doctors devoted to these in each one of these levels. These doctors are specialists on natural and traditional medicine. And at primary level, that is in polyclinical level, we have offices for natural and traditional medicine in integral rehabilitation services. We also have that in resorts and thermal centers, and they are in the hands of specialists. Another scenario where we apply this is in family doctors and family nurses' offices that have these specialties. They apply natural and traditional medicine, such as phytotherapy, apitherapy, homeopathics. They apply Ayurvedic medicine according to the courses they have followed. They have become specialized in. Also for dentists, those are applied particularly for different dentistry treatments according to pathologies in patients. They use phytotherapy, homeopathics, apitherapy, etc. And also in operation rooms, we have acupuncture also applied in all of our hospitals, and also in the secondary care level. In all cases in which people can be operated on with these techniques. And all of the emergency services, whether they are polyclinics or hospitals in Cuba, you always have an office for natural and traditional medicine. You apply treatment to patients, and then they go to the doctor's offices. And also in social institutions, like, for example, shelters for elders or psychopedagogical institutes. They are treated with different modalities according to their characteristics and needs. Concerning reference points for articulating natural and traditional medicine in the national healthcare system, we have integration of services and use of natural and traditional medicine modalities in the three levels of care. As we saw before, we have three levels: primary, secondary, and tertiary. Primary is family doctors and community polyclinics. Secondary is usual hospitals we have in all provinces. They are very well developed. And tertiary level, where we have specialized institutes. In all of the three levels, we have specialists in natural and traditional medicine, and they can work together with other medical specialists on visits, consultation, and exchange. We also have to take care with the availability of traditional medicine in the basic framework of natural products in the country. 172 are natural products. Some are produced by the Ministry of Health and others are produced locally. And we also have a regulatory framework that is coordinated with a segment and regulates everything that can be used and that is approved in natural and traditional medicine in our patients. Reference points for articulating natural and traditional medicine in the national healthcare system. We incorporate the contents of natural and traditional medicine in different medical science careers. There are research programs as from reordering of the science activity in the country that became central. And we also have research done in the third, fourth, fifth, and sixth year. We include those contents, and there are exchanges among professors and teachers, not only teach them how to use Western medicine and Western drugs, but also natural and traditional medicines. As I said, the research program has been reformulated. It is now a sectoral program. All the research done is included in the sectoral research program of the country. Intersectoral work with other state central administration organizations in close link with farming, because farmers produce medicinal plants with the characteristics, conditions, and quality required by uh, specialists, because we need to have a quality dry drug so that in the end we have the right quality. And this is carried out through meetings, talks with the Ministry of Agriculture and farmers, who are the ones that will produce the drug. This graph shows you how this integration has been produced in our system. We have data from 2015 to 2020. We can see we have 98 items in natural products, and now we have 172. And also the preparation of natural products compared between 2015 and 2020, the number of medical services between 2005. In 2019, we had a peak, but now in 2020, it decreased because of the COVID pandemic. In those cases, patients don't or didn't or don't go to doctors' offices because of COVID problems and the number of cases we have seen. And this is why we had less services supply. But that has increased between 2015. And here we have the specialists and residents in natural and traditional medicine between 2015 to 2020, which has also increased. And this shows the policy of the Cuban revolutionary government of paying very high attention to natural and traditional medicine to develop it scientifically and in a quality way.
And just to be in sync with this graph that we're showing you, within the protocols of attention of the patients with COVID in Cuba, we'll see that natural medicine is present in all of the protocols. And first, it applied homeopathy with a medication called Preventovi, which was given to all of the population through the family core, which was the first medication that was used in homeopathy in the COVID pandemic. And then after that, for the patient seeking its recovery situation, applied phytotherapy, apitherapy, and ozonotherapy. Ozonotherapy has decreased its level now and is being put up to patients that are PCR positive, persistent. Those have over 2 PCRs after the 5th or 7th day, following something positive, and then they start to get the ozonotherapy with the means of showing through this that patients have highest recovery. And in the post-COVID stage, they are given back again ozonotherapy to all of the patients with the symptoms of providing more recovery and the society recovery as well. Then we have to continue providing to the recovery of the services in primary healthcare, the introduction every year of new products according to the clinical tests and trials, and the technical report and investigation that will be taken more lean to solid basis, more trustworthy on the results of natural and traditional medicine. The update of regulatory framework protocols and good practices guide that constantly it's been updated, and that allows us to have a greater type of effectivity in traditional medicine and in the uh, local production of medicine. Thank you very much. Thank you very much, Dr. Ricardo. It's been a real pleasure to hear you in Cuba. Thank you very much.
Ok, bueno, ustedes acaban de ver
Okay, then
un video pregrabado
you just
Cortés.
a pre-recorded video of Dr. Cortez.
No sé si se dieron cuenta, pero
I don't know if you noticed, but it looked like
y
it was almost like live, and we appreciate this because not just this
presentación y la última
presentation, but the previous one of Katie
porque
were pre-recorded videos because we understand that trying to avoid any type of connectivity errors, they were kind enough to provide and give these countries timely their experiences, and it's really been important. Now we give floor to Dr. Maritza Ruiz Aviles from Nicaragua that's going to share her implementation experiences from MTCIs in services of health of her country.
Adelante, doctora Ruiz.
Please go ahead, Dr. Ruiz. Good afternoon, everyone. Thank you very much to the organization's team of this important event in behalf of the Ministry of Health and the Medicine Institute of Natural Medicine that I'm a part of. Thank you for giving us this opportunity of sharing these experiences that we have had during these years in the implementation of natural medicine, traditional and complementary therapies in the Nicaraguan health service. Thank you. And next slide, please. Thanks to a firm commitment and political will that our governments have of unity and social reconciliation, is that we've been implementing a model of community health focus of ensuring their population the free access to all of the health services and that has universal access in a way that every citizen can have access to the attention or the specialized attention even without any cost and to be able to ensure basic medication and also natural medication herbal products in the attention to natural medicine. And then hopefully they can also receive complementary therapies that in different countries have a high cost for population in this country. Thanks to this collaboration, we have patients that can receive this free collaboration and with warm and quality of uh, humanity of our staff that's constantly strengthened to ensure an excellent attention in this structure. Our community health model has an emphasis more than in rehab and in the recovery of patients, and also pays a lot of attention to the promotion and to the prevention of diseases, especially chronic non-transmittable. And through our clinics of natural medicine and complementary therapists across the country that we have this carried out in a way that we help to the reduction of hospitalization due to medical complications that take and lead a lot of chronic patients. And we also are able to provide an early uptake of this chronic disease. We provide attention, service, and treatment to those with the common illnesses that end up harming our population and promote the use of medicinal plants or medicine-based treatments with plants and can replace this highly and expensive type of medication that can actually harm our finances. Another thing is to understand that this has a focus not just to the individual that's ill, but also pays a lot of emphasis into the community where they live with their families. And the important thing here is that it promotes the citizens and the population's participation. This means that our community network supports the Ministry of Health in the promotion and encouragement of this traditional medicine to all the country. Our Ministry of Health ensures attention and service to the population, not just in the health units, but also they go outside of the health units to provide medical assistance in all of the corners of the country, carrying out and taking all of the medical services, including natural and complementary medicine therapy. Next one, please. Our government pays a lot of emphasis into the promotion of the ancestry knowledge regarding ancestry medicine from originary populations and Afro-descendant, and also it tries to institutionalize and promote natural medicine practices and complementary therapies, but for that it had to create a strategy for it to respond and to develop this natural medicine across the years. And we had to create a legal framework, and we approved two important laws in our country, just as 774, which is a law of natural medicine and complementary therapy, where we have this law safeguarding and institutionalizes, regulates these practices of natural medicine, but also everything related to the production, distribution, commercialization of natural products, thanks to that law. Another law, 759, is the law of traditional ancestry medicine, and it is the things that to this law we acknowledge the right and we protect and we promote practices of traditional ancestry medicine in our population and our indigenous and Afro-descendant population, with the goals of strengthening every day the health and family community health model that our government is encouraging and pushing. Next slide. So as a part of this strategy and from the creation of the approval of these laws, also we guide towards teaching to encourage the research and investigation side, promotion, prevention of natural medicine in the health staff of the ministry. And we were able to do this with the opening in 2014 to December, the Institute of Natural Medicine and Complementary Therapies, for which I have to say I'm really proud of being a part of. And then in this institute, what we do is to create skills and competences in the health staff, medics, nurses, psychiatrists, psychologists, physiotherapists, etc., in the different complementary therapies that we provide currently to our population. This institute creates and develops skills across the health staff so they can afterwards they can go and provide these services as a free nature in the different clinics that were opened in the recent years since the formation or since the elaboration of these resources. Also, we wanted to integrate medicine in the health services, and that's for why we opened, as of today, we've opened 50 clinics of mental health where we are providing additional services of natural medicine and complementary therapies in behalf of our psychologists and doctors in the country. We have 50 of them open, but we have 91 psychologists and psychiatrists that were trained in this institution. And we've also opened around 73 clinics of holistic pain management located in the areas of rehab hospitals and health centers where the physical therapists work. They were also trained in this institution, and they provide services of natural medicine, complementary therapy for the process and to ensure this rehabilitation process, which will be more accelerated in the patients, and then they are able to incorporate it faster to their own task and to their own daily lives. As a part of this strategy from our government, we want to achieve articulation of traditional medicine, ancestry traditional medicine with the Ministry of Health, so we can create joint working plans in benefit of our population. for the strengthening, of course, again, of our health model. Next slide. Next slide. After the opening of our institute, there were 15 branches created across the country, and in these branches, they replicate these workshops and seminars. So the community network will be promoted alongside the network and the community of medicinal plants for the population can be able to know what plants are the autochthonous plants of each region, and so they can use it when they encounter a acute emergency situations. And maybe these are communities that are isolated and we have some sort of access difficulties, so they can probably in an early stage they can use a rational use of an adequate use of these medicinal plants.
Tenemos trabajando a fitoterapeutas que son coordinadores.
In these branches of the institute, we have physical therapists that are also coordinators and that will be carrying out a plan of spreading out of the information about this medicine, getting every year a percentage of promoters in health, of natural health, which are members of the community network. Then, through these branches are also developing activities for promotion and prevention. They encourage a lot of encounters so they can give out lectures about a healthy lifestyle in the population in a way to encourage and influence in these groups in an early stage and groups that are of high risk like teenagers and younger people. There they provide also certain therapies. The demonstration of these therapies are developed in the different clinics so the community can get to know the existence of the same clinics, but at the same time can conduct holistic practices like Tai Chi, Qigong, for the benefit of the population and for care of the mental inclusive health. Next one. Next one. As a part of this strategy of integration of medicine, we opened clinics across the country that provided natural medicine services as a free manner. This clinic started by inaugurating the primary care level in family and community health centers. Then afterwards, they opened clinics in the polyclinics. Then they inaugurated clinics in primary care hospitals until they reached the level of clinics in some departmental hospitals. These were around 190 clinics of natural medicine that we have across the country, 50 clinics of mental health, and 73 clinics of holistic management for pain that are already providing attention and service free. Next one. Next slide, please. Next one, please. So all of the staff that works in these clinics were part of the resources of health that were trained in this institution and that continuously work and receive lectures, courses, seminaries, congresses, diplomats, basic diplomats, specialization courses in all of the different types of natural medicine. And so far, we were able to achieve the building of setting up guides for natural medicine, developing protocols of service and treatment for with natural medicine for certain illnesses, and then the manufacturing of guides of provision of natural products and informational guides with the statistics so we can carry out a systemization of all of the services that we provide in the different services across the country. Next slide. Next slide, please. In the medicine clinic, in natural and complementary therapies medicine, we provide phytotherapy where they are prescribing live plants, they are prescribing products or herbal products, and they make different types of therapies like shiatsu, massage, acupuncture, and different modalities, reflexology, and then they also promote the practice of Tai Chi and Qigong with patients that have different internal equilibrium practices like visualization, breathing, and this allows patients to complement their medical focus or medical approach that they receive in the traditional health centers with natural medicine practices. And we also promote healthy lifestyles, encouraging people, the patient and their families to adopt healthier lifestyles regarding nutrition, regarding the activities that they do, trying to avoid sedentarism or stationarity that hurts so much to our physical status. Next slide, please. Next one. And the clinics for holistic management of health are located in the rehab areas of the health centers and the primary care centers, departmental hospitals, and of national reference and polyclinics. They work there with physical therapists that provide services alike our physical or physical clinical therapists, but with a different focus because here this would be directed to a patient that needs rehab after suffering, for example, strokes or amputations, or patients that suffer from chronic persistent pain, uh, pain that is difficult to manage with natural or with conventional medicine. And the focus or the approach goes after this type of patients with mainly the same types of therapies. It's just a difference, and a difference to this. These patients can receive or could receive a therapy named or called the neurotherapy, so they can have an early rehab. At the same time, these patients go to clinics and they go on their free will, or they could be transferred by medical staff, being by the same institution or different types of health services. And these patients get to these type of services where they are really well responded to. Next one, please. Next one. Next slide. Also, we have the mental health service attention with complementary therapies, just as a floral back therapy, total reflexology, internal equilibrium, and then the prescription of plants in patients that are receiving psychosocial attention in our country. And since last year, we've opened 50 clinics that are already providing psychosocial attention and medicine services for natural medicine completely for free. Patients receive this type of uh, treatment with thorough medicine, treatment with different practices that are completely for free with no cost to the population. Next one. Next slide, please. So from the Institute, we organize, we conduct a national plan for promotion, and this is developed in the basis of the Institute, where they carry out a program of promotion and diffusion of information to the population of all of the natural medicines that are cataloged as a 7-7 law, as something that we need to take this to outside of the unit of existence to provide service and attention and health services for taking natural medicine to these communities, and also taking the message of natural medicine in the health fairs that are conducted across the country. Also, the staff visits the mother houses of the elder people homes, and then they we are working this year with home care staff, and we are preparing them for the provision of this type of therapy for these patients with natural medicine practices. Next one. Next one, please. As up to date with really a lot of pride, we can say that we have over 800,000 appointments provided, 651,000 complementary therapies given. We have also provided over 1 million prescriptions of live plants and herbal medicine that we've achieved in this period of time. We keep on growing, and we are strengthened. And all of this is thanks to the support and the constant support of our government. Next one, please.
Siguiente.
Yes, next one.
En referencia, ¿verdad?
So in reference to this, to traditional ancestry medicine, the ministry conducts a series of joint activities with the different specialists of ancestry understanding, traditional medicine, midwife, healers for snake bites, and so on, with the means of making joint work for the benefit of our population and to keep on strengthening the model of health for family that our governments encourage. We have developed encounters with midwives, with healers of herbs, with snake bite healers, and the thing here is to build this guide of caring of intercultural healthcare for the management of snake bites, or to also deal with intercultural diseases in a way that we can build this dialogue among these two types of medicine
Un momento una articulación de la
to be able to gain to articulate traditional medicine, ancestry traditional medicine with conventional medicine of the country. Next one, please. We invite now to these doctors every year to keep on conducting dialogues with our own health staff. And we have people that work with bones and healers to share with the health staff and with the physical therapists and to share this knowledge on how they are approaching this health problem in the community for the health staff to be sensitized in the ancestry medicine scope under the framework of respect among the different medicines. We were able to make a collective construction of an intercultural protocol for patients with snake bites and an intercultural protocol which is in production of patients with diseases of cultural affiliation. And we've also been able to translate our 774 law and 759 in the different languages to be able to spread the word about this law in the country. Hey, you have 2 minutes, doctor. I'm sorry. Perfect. That's okay. Thank you. Next slide, please. We have a lot of challenges and a lot of things that were achieved also because we are still thinking of strengthening the community network and keep on preparing our staff, raising the amount of teachings in this institution with the means of improving healthcare every day. So thank you very much to everyone here. This has been my participation. Thank you, Dr. Ruiz, for your presentation. And we'll now go to our last presentation. It's a pre-recorded video. We've already commented from in charge of Dr. Jesse Letelier in Haiti, where we are going to share her experience.
Monsieur le doyen du Conseil national du Collège médical de Pérou, Madame la présidente du comité consultatif permanent.
Mr. Dean of the National Council of the Medical School of Peru, Mrs. President of the Consultative Committee and Permanent about MTCI, ladies and gentlemen, representative of the VVS MTCI of the Americas, beloved collaborators of the Pan American Health Station, ladies and gentlemen from the Regional Network, MTCI, members of the Regional Network of Alternative and Complementary Medicine, members of the panel, beloved guests, good day, good
morning,
evening,
good
everyone.
afternoon to
It's a
you
real
all.
honor for me to be here
It's an
participating in
honor
this
to
second
participate in the second summit of traditional medicine
and for me,
in
it's of great
health in
importance
Haiti.
because
I'm
this
going to talk
second
about the
summit of
strategy.
traditional medicine, it's it lines
And this
itself
is
to
the
the
exchange,
strategy
the space in the
of the
different
traditional
parts of the
medicine
region
established
concerning
for
articulation of
2014-2023
integrative medicine.
as an
So
objective
I take
to
advantage
offer a
to
space of
greet and
exchange among the different
congratulate the
countries
members
on the process of
of this
articulation on traditional
summit for
medicine,
this
complementary
initiative. As
medicine, and
I
integrative.
announced, my
It's also a good
participation
time
is
for us to
to
take
share
advantage of
with
this
you
opportunity
the
to
main
congratulate to the members of the
experiences in Haiti
organization
concerning
of this
traditional medicine.
summit for this important initiative. As announced, this presentation, our presentation will be about sharing with you the main experiences of Haiti in the field of traditional medicine. So during this intervention, we will be checking the context, the general context, current context of traditional medicine at the national level, and then we will look at the main lines of a legal framework and regulatory framework that is established in the Haitian medicine. We will also look at the level of importance of the traditional medicine in the strategy and the programs of health service that finally will be introduced in the plans of in perspective of the Ministry of Public Health and the population in the promotion of this traditional medicine in Haiti. So, in a way of introduction, let's remind that the Haitian government, in particular, uh, through the constitution, recognizes the right to health and promotes rights and fundamental rights of all of the citizens of the country. And the Ministry of Public Health and Population is a key core entity of the government that's in charge of ensuring this right for everyone. The ministry has the responsibility of make everything happen and possible in close collaboration with the other authorities in the government to be involved in this matter to regulate, manage the health system through the execution of a series of interventions that have the main, in particular, goal of ensuring universality, integrality, and equity in the attention of health to all of the patient population. In comparison with the sector of traditional medicine, during a few decades and alongside the conventional medicine, traditional medicine has been one of the important pillars of the patient health system. In the last studies and research we've seen in the country that there's been proven that over 70% of the population would use traditional medicine in case of health problems. These results were confirmed in the importance that this medicine in Haitian communities has and in general in the health system, especially in what refers to the service in primary in primary health care. That's why, as a matter of fact, it compensates all of the challenges of access, geographically speaking or financially speaking, that this service can face towards the population. So, who are the stakeholders of this sector? The actors or stakeholders of traditional medicine in Haiti are, in first place, the families themselves in relation with some of the citizens in households that are provided by their members with, for example, teas or herbal teas. Then the other stakeholders, an important part of this and key in the sector, are the traditional therapists. In this category, we have the traditional practitioners, we have those that classify or are classified regarding their competence field and their activities also. They can be known in the community as lead doctors, midwives, embalmers, or voodoo priests. So, in terms of scientific investigation, the academic sector also plays a part that's really important in the development and promotion of traditional medicine in Haiti. This is a really the very center of the Ministry of Public Health and Population through the Division of Pharmacology, Natural Medicine, and Traditional Medicine has collaborated in this sector, including in the academic sector with other countries in the Caribbean region to carry out activities and regional activities in the field of the MT. For example, Haiti, alongside different countries of Caribbean, have collaborated with the Tramil group to identify many plants and validate their therapeutic uses. the work that has been carried out through and being pulled through has a result now that is being published in the Caribbean Vegetal Pharmacopoeia, which the first French edition was published in 1996 until the third one, which was published in 2014. We also, and just recently last year, the use of the MD has seen the rebirth of the service and the interest of Haiti in the context of the COVID-19 pandemic. In response to this pandemic, several members of the Haitian community have manufactured different local recipes. And the State University of Haiti has taken advantage of this opportunity to gather them and to gather all this data and information in the different recipes. We also publish a document that gathers different recipes, traditional recipes that have been used by the Haitian population to prevent COVID-19. And that's how, as a part of this work, the main and principal key to make this inventory happen is to have a documentary assessment and to have the phytotherapy happen in the country. That's why we understand that we have a increasing confirmation of the interest of the population in Haiti towards traditional medicine. From the point of view of regulation, traditional medicine in Haiti has a really important place in terms of sanitary politics. This is a topic that the government pays a lot of attention to at the point of considering the articulation with conventional medicine. To achieve this objective, the government has taken some compromises, commitments that have been materialized through, in particular, of the review of the allocated regulation in the division of pharmacy and medicine of the MSPP, where its medicinal or traditional medicine component has been added up to all of their main responsibilities. We can also emphasize the existence of a regulatory framework in relationship with the traditional pharmacopoeia, and this is through this framework and through the public health ministry and the populations that we put at the disposal of these stakeholders of health to make field in this change with regulations, procedures for the registry of this type of medications that are herb-based. Also, we have presented and we have put at the disposal of the professional guidelines of good practices of the manufacturing of medication that are based on plants, guidelines of the quality insurance system in the field of traditional medicine, especially in that what has to do with the medication production based on plants, and also guidelines to learn how to make the reports and templates of request of commercialization and authorization of commercialization of medications plant-based. Through these specific goals and of the national health policy, the government of Haiti has committed to establish a health system that would ensure the coverage of health in the country and that would satisfy the essential needs of health of the population, promoting at the same time in the articulation of conventional and traditional medicine. Also, derivating for national policy of health, the pharmaceutical policy in the country practically will be broadened and it will have the same type of direction when reassuring the commitment of the government to promote MD and the medications that are plant-based. Through this strategic axle, the Ministry of Public Health and Populations has set the objective of knowing better, preserve, and consolidate the medication part and plant-based and traditional medications as well to be included in the health system. In conformity with the national health policy, the master health plan integrates the sector in the structure of the system of health that's organic, meaning that in respect of the organization of the health services as in the financiation or financing of the system. And by being a cultural heritage element, the MD will be then more accessible for the population and geographically more accessible, especially in those rural areas of the country. In different documents and strategic documents related to the promotion policy, the government recognizes and agrees on how important traditional healers are for the health system. In this case, for example, the preparation and response plan facing COVID, where the Ministry of Health and Population has identified a key part on stakeholders of this sector in response interventions. In the strategic national sexual and reproductive health plan, the government recognizes the part of midwife and traditional midwives in the context where almost 60% of births have and take place outside of a health institution without the participation of a qualified staff. In AMOS 6, which is a study of the national health, the practitioners which are traditional were identified as a source of consultancy or treatment for kids with different problems. This has to be proven, I would say. The particular importance that the government of Haiti provides, in particular to the Ministry of Health and the Population, and to the traditional medicine, through the recognition and the establishing and showing how valued the local capacities should be and should be available in the sector.
En élaborant et en promulguant une loi et qui réglemente l'utilisation des médicaments traditionnels et à base de plantes dans le pays. Il s'agira aussi pour nous de développer, de systématiser les connaissances en termes de savoir et savoir-faire et relatifs aux médicaments traditionnels et à base de plantes et de renforcer la collaboration entre les différents acteurs et multisectoriels. Donc, en conclusion, nous pouvons dire que la médecine traditionnelle reste un important pilier dans le système national de santé haïtien parce qu'elle contribue à faciliter l'accès aux soins de santé à la majorité de la population qui tend à l'utiliser généralement en premier recours. Et des efforts sont entrepris depuis plusieurs années en vue de la valorisation et de l'intégration de la médecine traditionnelle dans le système de santé en Haïti. Donc, cependant, beaucoup de chemin reste encore à parcourir pour concrétiser la vision de l'État haïtien par rapport à ce secteur. Néanmoins, nous continuons à œuvrer en renforçant les mécanismes de partenariat nationaux et internationaux, particulièrement avec le pays de la région qui partage cette même vision d'aboutir à une médecine traditionnelle intégrée dans le système de santé afin d'atteindre les objectifs que nous nous sommes fixés. Donc, je terminerai par les mots de la ministre de la Santé publique et de la Population qui ont été prononcés lors de la première conférence nationale sur la médecine traditionnelle en 2017 pour rappeler que le rêve d'aboutir à la cohabitation de la médecine conventionnelle et la médecine traditionnelle, ce rêve sera possible à condition que tous les acteurs de la médecine scientifique et les acteurs de la médecine conventionnelle se mettent ensemble pour servir la collectivité dans toute sa globalité. Je vous remercie de votre attention.
Bueno.
Very well. Very good. I'd like to congratulate all the panelists and the doctors from Haiti and Cuba because they adjusted their time to what we required.
We have some
questions.
We're
going to take advantage of this time to have two questions, and then we will close this panel.
And
we have a question for Dr. Ruiz.
And it's the following
one.
Dr. Ruiz, we have
are there organizations or associations that
are linked to traditional medicine
related to
medicine? And if you can
traditional complementary medicine? how are
traditional
they
doctors according
acknowledged
to the
according
Nicaraguan
to
law?
law in
We have two
Nicaragua? These
questions
are
here,
two
but I would
questions.
appreciate if you
Please
could
answer them
respond
at
to this. We
once
hope
in
that
a
if you
couple
could
of
do so
minutes
in a couple of
max.
minutes. Speak up, please.
Yes,
Thank you very
thank
much.
you.
We have
There are
certain
some organizations,
are
but
not of
they
the
are not
government.
governmental organizations.
There is
We
the
have the
Naturalist and Doctor Association of Nicaragua. We
Naturalist
have the Integrated
Doctors Association in Nicaragua. We have
naturalist doctors
Oriental
and different
doctors,
specialists in different
naturopathics, and
complementary
specialists
therapies.
in complementary
But these
therapies. But
organisms, as I
these
said, that
are
are non-governmental.
non-governmental
In
organizations.
the
In the
case of
case
the
of
recognition of traditional doctors
acknowledgement of
and
traditional
the specialty of ancestral
doctors
knowledge,
and
let's
the
be reminded
specialists of
that
ancestral
these
medicine, we
people have their
must
own ways,
understand that these
special
people
ways,
have
and their
their
own ways of organization. They
organizational
have their own territory governments.
own ways.
So
They have
have
territorial
full control of
governments
all of the
and
specialists
or
and experts
governance,
in
and
all
they
of
have
the
experts in
scopes of
different
traditional
disciplines of
medicine,
traditional
and the
medicines,
recognition
and
is given by all
they
of
are
the
acknowledged
authorities,
by their
local
own
authorities for that.
local
They
authorities. They have a record and they
recognized
are acknowledged by their own communities in the different rural communities of the countries. Councils of
for different structures of
elders and
government.
other governance structures record what traditional doctors do in their territories. They are the ones that witness about these practices and practitioners. Thank you very much, Dr. Ruiz. There's another question for our lecturers.
I have a couple of questions.
Please help me with 1 minute or 1.5 minutes. Do you have any experience in your countries? And I'd like to start with Dr. Almaguer. Do you have any experience in your countries concerning healthcare according to Hippocrates using the food traditions, using biothermal foods to prevent transmissible and non-transmissible diseases? Thank you very much for your question. Look, specifically in this regard, we do not have this, but we do have healthy nutrition, and it's very interesting because this happened in the largest city in the country, Mexico, Mexico City. There we have evidence, and you understand that not in all the municipalities. It was in 3 municipalities with food and exercise. And there we are following groups of people in 3 municipalities with chronic diseases. And we can clearly see that there's a breaking point with culturally relevant food. Now, particularly in that world vision, not. But that's what we're doing. Thank you. Dr. Ruiz, do you have any comments here? Anything to add? No. No, thank you. Okay. You're silenced, sir. You're muted. Oh, yes. Excuse me. And there is a last question to close this panel. There's a question for our lecturers. Can you define intercultural Andean health, that is the healers of indigenous Latin America? Yes, go ahead, doctor. Well, not the Andean ones, but that's a very interesting question. The concept of health, disease, and death is a concept related to culture. This is why the intercultural approach framed in an intercultural policy for health helps us listen to users and suppliers' expectations. Generally speaking, suppliers think in their own model, what they know about it. All the rest is unknown, strange, and sometimes shocking in the care model. The key is there in supplying healthcare services in an intercultural perspective, and also with gender equity within the framework of respect for human rights. Yes, the sick person or the user expresses what he or she knows about his or her disease, and there is a crash with a conventional doctor that will be receiving him or her. And this is the science model. And if they don't if they don't make contact, one thinks that that concept of health, disease, and death has a different perception. So they won't contact each other. There is no assertive communication. So it won't work. And we have expenditure. On the one hand, the sick person said he didn't understand. Why does he think that I'm going to take that? And the supplier, health provider said, I didn't understand, but I'll give him or her this meanwhile. So there is a strategic element there, not only for cost contention, but also to surveil risks and harm in healthcare provision. So the intercultural approach is very important. The question was for the Andean guys. I hope they answer because I'd like to learn. Yes, we did progress concerning that. Not only that, and I finish in 1 minute, Hernan, if you allow me. Like 7 years ago, a health undersecretary in Mexico said, we'll do research and see if the healthcare message reaches the population. Since he was a remarkable epidemiologist, he said, we'll choose the malaria program. There was this research made not with the anthropologists of the health secretariat. They didn't tell us. And what did they find? That the official message on malaria did not reach the population. And they said the population didn't understand. Well, no, they didn't understand that message. They know about malaria with another name, with other manifestations. They know how it is transmitted. They know how to control it. It's extraordinary, but an indigenous person from Oaxaca did not allow his house to be fumigated with DDT to kill mosquitoes. And as a national epidemiologist, I was invited. This was in 1986 to tell those people not to be ignorant, to let fumigators spray their homes. And I said, well, my colleagues in the official medicine thought I would be on the side of official medicine. And I was on the side of the families. When they expressed themselves, they said, we don't spray here because mosquitoes don't reach this place. And I'll tell you what reaches. Once the home is sprayed with what you bring, our hens die and no one recovers our hens. And the program does not consider this. In those years, with deep honesty, I imagined this issue of interculturality in health. And thanks to Vicente Gavarras and Hernan Garcia, my collaborators, we started with an intercultural policy. Yes, the people know, the people understand. And I close with this. Malaria treatment comes from a bark, right? A tree bark. I finished with that. It's not that they didn't know about malaria. They didn't understand what we wanted to tell them about malaria. Thank you. Thank you, Dr. Amaguer. Yeah, we have a last minute, and I will take advantage of it to say that the experiences shared by different countries, Mexico, Cuba, Nicaragua, Haiti, and of course, the experience of Dr. Fine in veteran hospitals in the United States have been very interesting. I just totally say that progress made in each country is something that we are pleased about. We'd like the progress made in each country to be replicated in models in different countries that could adopt them according to their own contexts and conditions. So congratulations. And I think time is over. I have been told that we will have an active pause and meditation under the charge of Jorge Guerra, who directs the Ayurveda Foundation Prema. So Jorge, welcome. Thank you to all of our panelists, and I wish you a good rest of the day. Thank you very much. Very kind. Hernan, I think it's your turn. Well, truly, congratulations to all panelists and all the people who are attending this summit. We are seeing information, material, experiences, future paths that are touching us all and reaching our hearts, and we have to move a little bit. So I suggest to do something quickly so we can contact everything that will continue being so interesting soon. We will rub ourselves around the small areas with round movements, long areas with long movements. Our faces are eyes, and you have meditation techniques. Put a hand on your abdomen, another hand on your thorax, and deep briefly. And let us check which hand moves more, the thorax one or the abdomen one. And for all of us, we have to breathe deeply at the bottom. Here at the top, lungs are protected, but they're also like in a jail. If we breathe here, up here, it's less efficient. We won't have sufficient air. We'll have the anxiety and concern sensation, and that will be connected with stress. After these small movements, we will simply sit on our axis, well located, and will inhale just with one nostril. We will inhale through the left nostril softly. Then we change, we exhale by the right, and we inhale again, and we change to the left nostril. We inhale and exhale. I do so so you can see it. We do that with the left one, we exhale through the right one, and we do that in 2 or 3 cycles, each one of you with your own pace. And now that we are more focused, harmonic, well located, we're going to think about something that brings us peace and serenity. It can be the image of a flower, the image of a sky full of stars, the image of one of our teachers, the image of ocean. It can also be the image of a candle that will transport us to everything life brings. I will share with you a candle for a small meditation on light. We will first imagine that this candle is going to our forehead.
And then it lights our forehead, and it will keep on lighting and illuminating all of the web or mesh thoughts that are repeating day in and out. And for this light to really be expressed and to talk on its own steps, on its own generosity, open across the theoretical intellect. And that's how we still connect with this light. And we'll be taking this light towards the middle of our body. We carry this light to the middle of our hearts. And in the middle of our heart, we establish it. And little by little, we are illuminating our body even more. And it will illuminate our arms, our elbows, our wrists, our hands. For these hands that nature and whatever it was gave it to us, for them to serve and to do good. And we carry this light that we still have in our heart, and that it will be opening more and more, petal by petal, far in, far out, light that will be setting, that will be making and spreading out health, strength, energy, each part of our body. It illuminates all of our digestive system, all of our excretive system, our digestive system, all of our system of transformation of bad into good. And we also have it even our lower limbs to our feet. And these feet that allow us to be really well established in the world, walking side by side to those places where good is, and carrying with us everything that's related to good. We go back to the middle of our hearts and we stay there for some minutes in love with this light, with this energy, with this power, with this path, with this north and this path that we need to follow through, with this compass that's showing us how and where to go to be more deployed, to be better human beings, to be more contacted with the highest and with supreme. We're still connected with light, establishing where we are seated with a column and an axle, with our head relaxed, loose, free of thoughts. And each time this light will be dominating, will be expanding in our body, and you will get to those that share the household, the neighborhood, the community, and it's still expanding, and it will also cover all of our state, our province, our country. We see the light also reaches all of the Latin American region, and it unites many other lights that are already working for each time better and better the world can shine more. These lights also, they dominate and they establish all over the world. And we are at a unity of strength, of light, of power, of our own profound feeling and sense of joy and love. We carry on and we send this light to those that need it, to our family members, to those that we love, to those that are sick or suffering, for them to be able to get in a hold of this source of power and energy. In the meantime, we keep on breathing with a lot of fluidity, at ease, with serenity. And from this light, from this heart that unites our intellect, that show us the path to follow, we get a hold and we get in contact with the future steps that we need to take in these special times. So challenging. So convulsive, but at the same time, that bring with them a whole new world. From this health, from this light, we greet you all, and we now carry on with today's activities of this beautiful summit. This beautiful summit that's gathering us all to improving our health, to have better health across our region. A real big hug to all of you. Thank you very much, Jorge. Thank you very much to all of us, our assistants. Let's remind you that we are in two lines in YouTube. We are in the YouTube channel of the Financial Consortium of Integrative Health. We are transmitting in English there, and the YouTube channel of the National Library of Complementary Integrative Health, UVSC and TCI. We're transmitting in Spanish, so we're going to make a brief pause before carrying on with our previous to final panel. Thank you very much to everyone.
buenas tardes con todos.
Good afternoon, everyone. Good afternoon, everyone. It's a real pleasure to be here with all of you. My name is Yolanda Angulo Bazan. I'm a surgeon doctor, and I'm a part of the Executive Division of Alternative Medicine and Complementary Medicine of the National Center of Intercultural Health, which is a part of the National Institute of Peru. And for me, it's a real honor to be here with you as a moderator of panel number 4 of the organizational experiences, implementation, and management of traditional medicine, complementary, integrative in the systems and health systems of South America. As you can see, the objective of this panel today is to share the experiences of implementation, organization, management of traditional medicine, complementary and alternative and integrative as well in systems of health in South America. For that, we have 3 panelists today that we are going to provide us and share a little bit of the experience and also to introduce us to the first one. First, we have Islandia Maria Carvalho de Souza, which is a part of the National Observatory of Knowledge and Traditional Practice and Complementary Practices of Health, Observa PICS from Brazil. Dr. Islandia is a researcher in public health of the Collective Health Department with the Osvaldo Cruz Foundation of Pernambuco, Brazil. She's a subdirector of the research group of economy policies of health. She's also the executive coordinator of the National Observatory of Traditional Knowledge and Integrative Practices and Complementary Practices. She operates in the software production for the popularization of the science and technology. She's a member of the Brazilian Association in Health Economy and the Brazilian Association Collective Abras, which is also the coordinator of the investigation group of La Cruz. And thank you, Dr. Islandia. Next, we have Dr. Mónica Galanti de la Paz from the Chile University and the Hospital Roberto del Rio. She's a doctor in medicine, a specialist in pediatrics, and has a subspecialty in nephrology from the University of Chile. She's a child nephrologist in Roberto del Rio Public Hospital. Within her experiences in 2000, she started her complementary medicine studies, certifying fluorotherapy and synergetic medicine, approaching the Reiki and anthroposophic medicine. Between 2014 and 2020, she developed the part of complementary medicine consultant in the Department of Public Policies of the Secretariat of Public Health. The first 2 years after that, she went to the Subsecretariat Division of the Assistenciary Network of Chile's Ministry of Health. Thank you very much. And our last speaker is Dr. Claudia Matos, Complementary Medicine Manager of Salud, the Director of the Collaborator Center, OPS or OMS in Traditional and Complementary Medicine. She's Doctor of Medicine from the Universidad Cayetana Heredia from Peru. She has a master's in genetics from the McGill University in Canada. She has also training in yoga for the Isha Yoga Center in India. With no more ado, we now go to Dr. Islandia's presentation. You have 20 minutes, Dr. Islandia, and we're here to hear you. Please go ahead.
Thank you very much, Yolanda. I'm glad to be here with all of you. Please interrupt me if necessary. I'll try to speak slower, but if I if I take some more minutes, please let me know. This is the dream of Dr. Marta coming here with this work and doing this summit during a pandemic. I'm glad with all the results I've been listening these days. I work for the Ministry of Health. I don't work with the current coordination. My speech is going to be in the research area and some information that I received from the previous coordination office. Next, please. The first thing that I always talk about and other colleagues talked about as well, Brazil has a system that looks for 3 important principles: universality, equity, and comprehensiveness. It's one of the countries in America which is focused on health as a right. That was an achievement of the unified health system in 1988. As we have a very difficult moment. Many rights are at risk, stated in the Constitution, but through the pandemics, made the Brazilians understand and to have this universal health system. I'm not talking about coverage, I'm talking about universality access, universal access. I hope Brazil could inspire other people in America so we can talk about health. This health system was stated in Brazil in the 90s. This perspective of primary health care was to state this role, community participation. Each community participation was a person in the community, someone who assumed this link between the population and health services. And in 1996, we started with these family health strategy inspired in Cuban model, inspired as well by the English model. This characteristic of this family health strategy has as the foundation these healthcare, a doctor, a GP, a nurse, and other community actors who are responsible by specific regions and work with different families in these areas. And the idea of this strategy is connected to these territories. And we realized that there was an expansion of these integrative practices. That's why I'm bringing this model and I'm explaining to you how these integrative and complementary practices have been expanded. This model of a primary health care was developed since 1990 in all municipalities all over the country. They have certain kind of implementation, and they have shown along the years, 2 decades, an impact in children mortality. There are many studies showing this universal access in the vulnerable population. Brazil is different from other countries. As we are talking about traditional, complementary, integrative medicine. This was given because there is any demand from this society, from the constitution of other practices. There was a regulation in 2006. This has to do with all movement and was presented by previous speakers, trying to integrate some practices that is not within biomedic systems. This was not an easy challenge. It's not a law. We achieved a decree in 2006, what was called integrative and complementary practices in health care as medicine, seen in the National Council, had a different, was a complication in the Association of Doctors. That's why we had the name of Integrative and Complementary Practices in Healthcare. From the very beginning, a multidisciplinary practice matter. In Brazil, we call it PICS. It's the same as TCIM for other countries. So I will be calling this PICS. In 1986, there was a discussion regarding these practices in Brazil. And in 1988, there was another module discussing policies that was related to a movement in the population. These health national conferences where some guidelines were proposed. Even we talked about this in the 8th National Health Conference. There was a health movement, and in 1988, we were able to state these SUS and to start to talk about how to implement these practices in 2006 and in 2018, we were able to have this new expansion. There was a regulation, an important regulation, which is called National Policy on Natural Medicine and Complementary Practices. This was about the implementation of some services, health services. When we talk about regulations in private services, it's a little bit difficult, but the professional area to access to these practices, Brazil is not regulated by the health ministry. Each professional association regulates practice, which is complex, and this is a topic that has been discussed. All these is going to be discussed, and the training ways from the national health system. This is the timeline showing that within these national conferences where we had citizenships, representation, there was a demand from the 40s, 1940, some claims to have the implantation of traditional medicine being implanted, and in every single conference, the population was claiming, was demanding these traditional medicines. They were interested. It was challenging, but we did it. Between 2006 and 2018, there was an extension that from 2006 to 2018, in Europe, for example, talking about anthroposophic medicine, we started with acupuncture, phytotherapy, anthroposophic medicine, thermalism, and homeopathy. In 2017, 2018, there was an extension. Now we have 19 practices recognized by this policy, not necessarily existing within these practices, but the national policies are recognizing this possibility. In the case of that traditional indigenous medicine is not within the policies, and the popular medicine, they are not part of the national policies. It's another, I know that what is happening in Peru and Nicaragua, all these policies have been integrated. You are inspiring us to think about how to challenge Brazil. There are 195 ethnic groups in Brazil. Each indigenous people have their own way, their own perspective on what health is, what the disease is. So this integration within the national system, health system, is not easy, but it is important to discuss these matters on how these traditional medical activities will be integrated in the health system. We have some practices in Brazil that was introduction by political articulation called integrative community therapy. These group therapies during the pandemic was a growing practice and has brought new perspectives to be discussed on what integrative practices and national policies in Brazil. Next, please. This implementation has to take into account there are 5,570 municipalities, 208 billion people. Just imagine making policies in a country which is heterogeneous, completely different from in different areas, populations, territories with different cultures, even it is a whole country. We have two perspectives. These are the Ministry of Health statistics. When the Ministry of Health evaluates data, they count every offer, if there is a professional who is registered there. When there was a survey, they realized that there were 15,955 health services, and 92% of the establishment in primary care, that's why I talked about primary care, distributed in 4,323 municipalities, 27 states, 27 capital cities, and all these capital cities have some needs. At the same period, as researchers, we studied in the last decade this quality of the services offered. We presented some studies, and that there is, as the map is showing, mainly in which is in color in yellow and red. According to our research, there was some offers in integrative practices. There's something called rotation. In yellow, you can see that any professional or doctor from primary health, primary care, that it was impacted. And in red, we have the establishments who recognized that there were practices. Implementation of integrative practices has as important roles people, professionals of these family strategies who launched these and implemented these practices. They have made their efforts, and when we did this quantitative study and when we go into qualitative studies, the information we received is that these professionals who bought the materials, who invested from their own resources to do something, sometimes these professionals pay for many things so it is implemented in the system as a personal investment and not the management investment at that moment. Next, please. Apart from, well, what I've showed you on this difference from municipalities with some offers on the ones who were recognized, this investment from health professionals, in a way, even they were not recognized, but the management became visible in other areas. In Brazil, there are conferences in health management, 500 experiences which were evaluated on positive results, 60% in some integrative practices. This presence, big presence, this investment has worked in a way to make visible these professionals. And now we're discussing differently regarding these practices. And there is something as researchers to do some work here is that if health professionals are all over Brazil investing in these practices, it's because they have seen some results. There are some qualitative results that are showing that regarding medical services in primary care, they were extending some health services depending on territories. Mental health, for example, even with the changes of lifestyle, health promotion, it is not enough on what is existing in primary care, primarily in primary care. There are also some experiences in other areas. We have done the research and we detected 4 modules in Brazil from managers to make some arrangements to implement policies. There are municipalities and modules which are about implementation on primary care, mainly professionals. And we also have, as you saw in the map, these small investments of management units. And there are these specialty centers. It could be related to some universities or municipalities. State there is a specific service to be provided, and this offers these integrative practices. And we then have some mental health services, some hospitals in a way which are providing services on integrative practices. It is important to understand that most of these practices are not receiving investments by the federal government. Next, please. Next, please.
De certa forma, há investimento que o Brasil tem
The
feito.
investment Brazil made some courses, virtual workshops that are open to the population were discussed before this governmental situation. They were also translated to other languages, especially to these practices that they were discussing. Please, next. We also have experienced in Brazil, which has been successful before the government, a course on oracle therapy, which was a simple practices. It solved some problems and some requests of primary care with more than 7,000 professionals certified for primary care. This is the increase of these practices. As you can see, these practices which are multidisciplinary as body practices, yoga, grew rapidly, acupuncture as well, multidisciplinary practices. Many professionals made it grow. Practices such as, for example, homeopathy, which is only a specific professional, has not grown much. Homeopathy, it has decreased. There was a recent movement from popular, which we call popular or traditional doctors, professionals in homeopathy that were not succeeding in making grow this area. Yolanda, I'm just finishing. And during the pandemic, we also performed a study with the Observa Peaks and After Cruz, and we detected 61% of Brazilians I'm sorry, I can't hear the speaker. Problem with the time.
falar da... Pronto. Esse gráfico, ele mostra o crescimento
In
das
this
práticas
graph, we can see some the growth of integrative practices during the last 10 years up to 2017, because information also changed to this time. These multidisciplinary practices are growing. This is a discussion point. Who is performing acupuncture, who is not? There are some discussions in the professional body, and other professionals who are not from acupuncture, for example. These body practices, as you can see, this line is growing. Homeopathy and other practices have not grown much. Another thing that has happened is that as homeopathy requires to be inserted in the system and made popular among other professionals, it needs training, which has been discussed among other traditional professionals. These statistics, this data is recent. They will be published by the observatory, this Observa peaks the use of integrative practices during the pandemic. 61% of Brazilian people used some integrative practices to their healthcare, meditation, phytotherapy, and REC. The most used practices, we will be publishing this material along with the methodology on how we did it. We are inviting our colleagues, to the ones who are listening to us next week, to check, to review this methodology. It could also be performed in other countries. And we are showing a little bit the distribution, how this is different. In Brazil, you have the northern Brazil meditation, where there are more medicinal plants in northern Brazil. Center East, Center West as well, medicinal plants, and South, Reiki and meditation. I'm glad to sharing this with you. I think all events that are done, so that's why I thank you, Natalia. This idea is to put all these data together and to discuss traditional medicine in America. When I listen to you, I listen to this integration perspective, how important it is. Yolanda, can you hear me?
Sim,
You can continue with the next one.
Yes, doctor, you can
I'm
continue
just
with your next slide.
completing this presentation. This is a picture to listen. We need to be united to make impossible possible. We need to put all these actions together. I don't know how this is going to be done, but I think that all this data we worked on, which will be worked until Sunday, is a good idea to put all this narrative, as George was explaining, to take care the body, the humans, when they are sick. I invite you to unite, to work together. It's a video, but no problem. We can skip it. And we are at your request in the observatory, so we could work together for a new health is network, and to challenge what is the challenge with the bad things that are coming in the future. Thank you.
Thank you very much, doctor, for your presentation. Because of time, and we had a small inconvenience, so Monica will have 25 minutes for her presentation, and she can do so in a more extensive way and perhaps share more of her experience with us. And at the end, we'll have some space for debate. With no more to say, then I go with Dr. Monica Galanti. Doctor, you have the floor. Thank you very much. Well, good morning, good afternoon, good evening. Hello, everybody, with lots of love. It's really exciting to see how this meeting is going. We can share different experiences. We can get to know each other, see each other's faces, particularly my friends I met in 2017. I'm so proud to have you as friends. I love you a lot. Thank you very much for the work you're doing. For those who are listening, because we're all promoters of this learning to generate this loving integration for mutual respect, not competing, and putting our knowledge, feelings, and thoughts available for the good of us also. Thank you very much for your invitation. I wanted to share this screen with you. Can you see my screen? Yes, we can hear it perfectly well. Well, today I'm going to share the integration experience we have in Chile, this very thin and long country that I have divided in different regions. It has 16 regions and 346 communes, and it is in the communes where we manage primary health care. In 2017, we made a census, and we're about 17 million people in Chile. We have 196 hospitals and primary health care centers, 458, plus 1,129 rural posts and 100 low complexity establishments. Okay, just a sec, please.
Ahí volví, ¿verdad?
I'm back, right? Can you see me? Yes, we can see you, and the screen is also complete. Thinking about these new changes and visions we're trying to integrate and share for the good of society, as I was just saying, one of the things we need, among several, in conventional medicine, which has so many virtues, is to realize that besides all that we learned in diagnose and healing processes, we can see that people need more things, that we all need those things, no matter how scientific you are or how technological you are. If you're sick, you'll need those things. What do we need besides having professionals with broad scientific knowledge? We need the human being regard. Someone is looking at us. We are important to them. They are understanding us from our reality, from what is happening to us. So we need to be cared for. It's not only having tests, drugs, and prescriptions. We need to be understood in our reality, emotions, culture, spirituality. So we need that closeness. We don't want to be seen like a person who has a disease, but the person who we are, that we need to talk. We all need to express our emotions. And of course, all therapies that have to do with expressing emotions, such as art therapy, have shown benefit because there is a possibility of expressing what you are feeling. And also the right to receive truthful information of what happens to us and have a participation in that. Something that characterizes conventional medicine is that it's a bit paternalistic. There's little participation of the patient, the first promoters, and healers of ourselves are ourselves. If we were able to be more connected with what happens, our environment, the planet, other people, we would be able to know what is okay, what is not, and what we need. Without the participation of each one of us in our healing process, healing is practically impossible. So the idea is to be able to understand that there's no single system that satisfies all health demands, that medical pluralism has always existed since we exist, and that each one of us has different needs, and that we have different ways of preventing, healing, understanding what life is, what death is, and all this process of health and disease. If we were able to understand life from that perspective, we could be more compassionate with the people facing us and more compassion with ourselves. It's not that you feel pity, it's empathy, intense empathy with lots of love that helps us offer aid to these people. And we don't need to be a cutting edge professional for that. We need to be a human being who can look the other person in the eye and know what's happening with her and what she needs. In Chile, traditional complementary medicine has always existed. We have 9 indigenous peoples. Each one has a strong traditional medicine culture, and they continue using it. And besides, its use has become more frequent in populations not belonging to the same ethnic group. The people, besides looking for therapies that are different from conventional medicine, also look for what indigenous peoples offer, native peoples offer. And this is why we need to look at this with respect. In 2013, we started in 2012, and in 2013, we started with some studies to understand what was happening in our healthcare system. What I put here is different studies between 2012 and 2015 in the Ministry of Health in Chile. The objective was to get to know local realities, knowing what was happening, and the results of these studies highlighted the demand of the population, high demand of the population for complementary demands. The provision there was of this kind of medicine in healthcare institutions, even if we didn't have regulations about it. And it was happening, and notwithstanding what the Ministry of Health in Chile could say. Therefore, we obtained all this information through these studies. They provided us with very rich information. We started doing progress, and my colleague told you last Friday that between 2005 and 2008, we had collection of information on acupuncture, naturopathy, and we have regulated practice for them. They need to be trained and they have to take a test then through the Ministry of Health. We had other studies made later on to get to know what was the perception of benefit citizens had, both men and women, for different practices like acupuncture, floral therapy, homeopathics, naturopathy, Reiki, chiropractic, and others. Thought that they were benefited. More than 72.4% of the people thought this. I don't know if conventional medicine would have these figures. Later on in the National Healthcare poll or survey, we asked the people if they would like to have complementary practices in their healthcare establishments. More than 80% said yes in different educational and socio-economic segments. This is the result in the National Healthcare Survey. 85.8% of people who were asked said they would like to have complementary medicines in the public network. And when we repeated this survey in 2016, 2017, this figure had increased to 93%. If health professionals and Ministry of Health would like to respond to population demands, we have to know what they are all about. We need to know them to be able to offer these practices, ensure egalitarian and equitable access, and so that they can be provided with safety and quality. These are some photographs of different experiences. I'm going to show them little by little. Here, this is the Arturo López Pérez Foundation. This foundation treats oncological patients. Here in the middle, in this photograph, this is a musical therapy experience in intensive treatment in an intensive care unit in the hospital of the University of Chile, and this is in a primary health hospital. Why should we integrate complementary medicines to conventional medicine? Conventional medicine gives us lots of benefits in terms of diagnosis and healing, but we have a long way ahead to work with healthy lifestyle, self-care, health management, promoting natural, healthy lifestyles that will protect us against chronic diseases. And the benefits of TCIMs are that we offer healthy lifestyles in an individualized way, according to what the people think and feel. I can offer the same therapy to the same people. Some will find meaning in a therapy, or they will have one lifestyle that they can change or not. I have to see who is the person facing me. And that's one of the benefits and contributions of TCIM. I can broaden therapeutical possibilities, both conventional and other, like energy, relaxation, breathing, conscious eating, relaxing, etc. All this contributes to have more effective conventional therapies. In this way, we can guide the person for their self-care, their health self-management. Another benefit is that there aren't great differences in different care levels. If I offer a traditional complementary and integrative medicine in a hospital, that patient can continue with that same therapy in primary care. It's important for us to offer these practices more intensely in primary health care, where people can receive this kind of care and education on healthy lifestyles, health promotion, and prevention of non-transmissible, non-communicable diseases. Another benefit is that therapists are more aware and concerned about the people they face. So the relationship will improve and there will be no dropping of treatment. That would be a benefit for conventional medicine because many treatments are dropped in our country. For example, there are studies that show how patients don't follow indications, don't take medication. They even sell them in markets to get money. So if I can guide people from close and from trust, I can stimulate treatment compliance. Also, we can counsel patients on the free election of their therapy according to their risks and benefits. In this way, complementary medicine approaches conventional medicine and vice versa. The existence of integrative medicine units in the public network supports the bioethical principle of justice because it decreases health inequality gaps. In our country, the highest quintile is the one that has most access to these practices because they have the money to pay it, since they are not directly offered by the Ministry of Health in healthcare establishments.
And for this, we do require for regulation. We do require to be able to have a regulation that would allow us to have this matching in the visualization and backing up these practices to be able to offer them to the population in a safe way with quality. So it's really important. And once I have it regulated, to also obtain more money for them to be conducted and we can do studies and etc. However, this regulation is conducted from a situation of superiority of conventional medicine and not acknowledging how ideal or the essence that each practice has, then this regulation won't be real and we can end up regulating practices that will be able to be delivered as any other type of medication, and then we are going to be medicalizing therapy and not caring for the essence of each one. So the important thing is for this and not to be done in a subordinated manner, to do it together with the respect that it deserves, acknowledging the contribution of both. My colleague Jenny also talked about the complementary medicine benefit that we have since 2018 is MA31. And this was a pretty important step because it allowed us to get to know exactly what we do nationwide in regards to complementary medicine, what type of services do we conduct, who does it, who receives it, who derivates, etc. So for us, this was a really, really good advance. And we were looking at how in 2018, we had 165,487 services, and they were increasing in 2019, 2020 decreased due to the pandemic, and it really health centers, they all closed all the integrative medicine units with the idea of being able to transfer those health professionals to the ICU units where patients with COVID were. That is even recognized as a mistake, even because even in my country, primary care was pretty abandoned. We could have made or established this task of preventing infection by working closer with people and trying to help people more directly and trying to avoid them to get to get worse and at the end needing ICU. The REM has these four initial sections that in 2019 we spread them out to five sections. And these are the types of delivery therapy, who receives it, attentions according to the professional delivery of medicine, where the delivery comes from, as I was saying, and what type of therapy in practice should be delivered, and what type of practice will we develop in proper attention. The previous were about individual, and this section is about gathering information on the group services. And we have here, as I said before, that within the regulated we have an acupuncture, homeopathy, naturopathy. However, this REM says that within the practices and therapy that is offered the most in Chile is floral therapy, with 45,000 services in 2018, which was a year that we had less when we started with this registry, but we even saw that the floral therapy was therapy that we offer the most in our country, and unfortunately, we don't have any regulation in that sense. Then we have acupuncture, as you can see there. And then after that, we have Reiki, neurotherapy, and a huge number of others that we've opened in 2019. And then we had practice such as art therapy, music, art, dance therapy, synergetic medicine, and pranic healing. And these are practices that are offered frequently in our health centers as well. As I was saying, all of these offer that we provide in our health center depend on the health professional that work there and of the director of the health establishment that supports or not this idea under no this is not under any legislation or this doesn't come from the Ministry of Health, but this is more uh, from the health professionals themselves that want to provide a response to the population's demand, and that's why we have this really beautiful symbiosis between the health professional and who asks for this and this response and this will of providing these practices in the most effective way. Another advancement that we've done in the Ministry of Health was to advance and move to work with the expert of this matter nationwide, and we decided to work in integrated actions for hospitals and primary care. They're really alike, however, there's differences between technical uh, and primary assistance and at the hospitalian level. What happens in the primary care is a sort of more close type of attention with the population with a home visit or more closeness with the population with the health center. At hospitals, we find people that are sicker and that require a longer treatment. That's why we see some differences generated in this guidance they had to collaborate with and contribute to, where it was at hospitals, and it was defined as a clinical service that's inserted in a hospital center, and that's why we called it a hospitality integrated center, considering the whole person, mind, environment, incorporating education and healthy styles and lifestyles, not just in sickness, but the therapeutic relation has to promote the healthy lifestyle of people focusing on the people and with a lot of attention, considering people in their environment, with their culture, with their spirituality, with their emotions. And we have pictures here about our different experiences in health centers in our country. They're always sharing the photographies, and it's impressive how you can tell that everything that's offered at the country level with a lot of joy, with so much love that's offered, without having, like I said, any type of instruction from the government. Just with Dr. Islandia, you have 2 minutes. Let me finish. And just so the main goal of these integrative units is, of course, to be able to integrate these practices to the conventional system in an effective way with security, safety, providing strategies that will let us work in a multidisciplinary scope with people and improve people's quality of life. This is a picture of a from making hospital, and that will also have an integrative unit now that we built the new hospital. The specific goals of this unit is provide access to complementary medicine, efficient and of quality, to relieve symptoms and improve quality of life, to promote lifestyles that are healthy through a coordinated piece of work, generating efficiency, and developing in the academy, validating the functions in clinics in and population objective, which are used as the vital cycle. And I'm sorry, this previous slide is a picture of the new National Hospital for Cancer that will be built in the upcoming years, where we have a whole floor. This is the first floor. What's in pink is going to be the complementary medical unit. And this is for invasive therapy such as acupuncture, neurotherapy, and the focus of attention for non-invasive practices. And that will give us two multi-use rooms for yoga, meditation, therapy of arts, etc. Really, this is a really beautiful project that has us really, really happy. Services list, body and mind medicine, biologic practices, and that are based in energy. This is a picture of Luis Carlos Maquene Hospital, which is a pediatric hospital in Chile, which also has and offers Reiki, synergetic, and focus more to oncologic patients. The inclusion criteria of this hospitalary centers is the attention for ambulatory patients and hospitalized patients. In the human resources, we have this organigram where we see a chief of staff in coordination with the therapists of the different practices, and we define as well the profile of a therapist. We have here a flow chart of how the patient and who makes the consultation gets from the ambulatory level to the integrative unit. We define monitoring plans as well with the objective indicators. We have the different indicators here and documents for patients to be delivered. This is really organized, some exclusion criteria, and yeah, performance standards in the compliance of the first consultation of around an hour. When it's around more than 30 minutes, the group therapy 1.5 hours, and the number of sessions that are estimated as well. There are some of the experiences in Hospital Soto del Rio, which is an adult hospital that we can see they were going to start to respond in 2015 and 2015 2018. Look at how they increased in their attention, and they were able to study the decrease of the uh, medication requirement for pain, and this decrease in 54 patients decreased the requirements of medication for pain, and 12% didn't need any medicine at all anymore. And we see how it changed before therapy and after therapy. Also, they were able to measure the user satisfaction, which was really, really good with complementary therapy. Also, Reiki is offered in some experiences that Juan Noé dedicas with synesthetic. These are the primary care levels of attention. And well, that's basically it. And we see here how this derivatives increase within the hospital even once we were able to know the integrative medicine units and their benefit to the contribution. We saw the increase of this. There was also research done, and in this case, they respond to the question if acupuncture was effective for this type of work, which was really interesting type of work. That's a little bit of what I wanted to share with you today. And really, Dr. Roger, this morning, it inspired me quite a lot. It was really clear with all the points that he was mentioning because this seems to be so difficult, so different, or that it is difficult, but it shouldn't be, I guess. How can we make both visions to contribute to with the best that they have for the benefit of people? This has been said by the World Health Organization's people, and I hope that we can, through this bridge, we can get to communicate to respect, love, and not from differences, because we all want the best for ourselves, for our patients. Thank you very much. Thank you very much, Dr. Monica. I would like to probably share one specific slide for us to be able to open the room for questions and maybe discuss a bit about the current status of complementary and integrative medicine in our countries. Okay, let me see. We have. All right. Just to look at the current Peru situation and also to be able to um, comment on and to share. Maybe you know we have a pretty divided health system. We have the health entity ministry, which is the regulation entity. We have a lot of subsystems that cohabitate with one another, and sometimes they carry different responsibilities and bosses. For example, the Ministry of Health has certain functionalities in hospitals where they provide complementary medicine therapy. For example, this therapy in the ministries of health facilities are not associated to this. health centers have meaning. If somebody goes to the Ministry of Health Center and they find a guide of complementary medicine and they want to get treatment there, they're going to have to pay for everything. And differently from the social health insurance that many of you know, the experience of the Social Security for health improvement, that depends on the Ministry of Health. And that's where we have a really organized type of work with a structure, with a legal framework, where there is a list of complementary therapies for insured patients. And it has, again, this whole view of integrality that's being worked for many, many years by a entire team of work to be able to achieve all of this. And in the other hand, we have private services, providers of private services of health, where we have medical centers of support or centers that are not classified and can be monitored by the health system or the regulatory health system, and where we don't have any data about the real dimension of the supply and demand, and there's no regulation and authorization for this type of services. So we don't have, or improved situation is a situation where is a gap in regulation. In the regulation entity, we have a subsystem that it's acting in an organized manner, but it has its own limitations in the application field differently from the regulation entity. With that experience, and personally, I was able to find two difficulties where we have to be able to move forward in our process of articulation. And I would like to hear our two panelists' opinion about it. First off is the part of the academia. When we want to implement MAC regulation in Peru, we are told what's the accreditation that this professional, or how as a system we are going to ensure that this professional has the competences to be able to provide the complementary health services that we want. And our second point that I wanted to put on the table is the policies based on evidences that are really fashionable in health systems, especially in Latin American health systems, that implicate sometimes an interpretation where the managers indicate that if you have enough evidence to prove that this therapy is effective with patients, well, you cannot provide it without considering making a risk benefit balance with the patient's needs for these therapies to be provided, because they're already being provided with no control and with even unknown effects and exposing or endangering the population and the social cultural association that many of these therapies have. And they can probably aid at some point to approach the population to the health systems, as many investigations that have been led by MINSA has proven already. So I would like to know in these 2 points, what have the experiences been in Brazil and Chile, and what are the suggestions that you can provide to the managers in Peru? Thank you, Yolanda, for the question. When I was
eu fico pensando que essa narrativa da não evidência é uma narrativa global, né? Não só da construção de uma política, né, de publicação,
the construction of a policy, of publication, of technical results that are not a part of this. I would like to say so. You need to have two different movements that are part of it. First, the people who are working with these new methodologies that, where we have evidence and all the types of evidence that people are talking about the cultural appropriation, and they're more effective in these practices for results that are not established and determined for that. But however, we have these results for people as everything. We need to move forward because this is a real serious thing in Brazil. To have these two movements. If you unite all these integrative practices to a biometric model or to a way of check on medicine, you're never going to have a scientific evidence. People need to understand that they can grab a microscope and then they can just identify a virus, but that rather they need a model. They need to go undertake these models in a controlled environment. People that are doing this, it's not saying, it's not focusing on this. That's why people are saying, people are doing their own specific interventions and gathering their own results, and they are not matching with or checking with other countries. Just as we were talking about here, they're practicing acupuncture and many other treatments.
Eu quero estudar qual é o custo do serviço, né? E quais os efeitos que o serviço tem em determinada população, ou quando eu uso aquele serviço
established population.
para a minha saúde, dado o uso do serviço, porque eu já tive várias experiências que não é possível medir o custo-efetividade de uma prática, não no Brasil.
We've had a lot of experiences where we are not being able to identify the efficiency of some practices in Brazil. So the first challenge is of knowing. We need to incorporate new methodology. And for that, we need to get together experiences, and that's why we need to make it as inclusive as possible to discuss about policies as well. These practices need to be, let's say, from the point of view of people that need to have their own publishings. They need to focus on this, and people are not focusing on gathering information, despite having an industry that's already set and prepared, where they already producing phytotherapy. So we have a lot of challenges to take care of there. And then we need to discuss integrative practices, traditional medicine. In Brazil, there's a group of people that defend these practices, but they need to be discussed at the political level in Brazil. We need to discuss new practices. We need to discuss what's going on now, what are the areas of interest, who is acting in which field. So we need to discuss who is governing countries, because there's a lot of policies on regulations that are favoring people in certain scopes. So we need to probably start discussing this and discuss the methodology of certain practice or trials and how are we going to put it into practice. We need this type of scientific services to start new discussions and to occupy these new spaces. And another discussion or political discussion that comes out of that. Mas se o governo investe para as pessoas meditarem, isso é problema, porque isso não é saúde. E a gente precisa fazer essa provocação. Seria nesses dois aspectos. Espero ter contribuído.
Muchas gracias, doctora Islandia.
Thank you very much, Dr. Islandia. Dr. Monica, additionally to what you're going to be sharing with us, we have two more questions that I'm going to try to summarize as much as we can, because we are flying with time. We hear also, or we know that people want to know about how to move forward in Chile with integrative medicine beyond complementary and traditional medicines that are being managed nowadays on the system, just like what happens in Peru almost. Thank you very much. Responding to the first thing that you were asking us, really, I think that is a key point for this difficulty. What happens with evidence? What happens with professionals that are undertaking these practices? I believe, but this is really personal. I believe that the solution, as we've seen throughout the day, is complicated, and it's complicated in different countries, even in countries where traditional medicine is really strong on their side. But basically, I believe that at the government's level of the governments, instead of focusing on evidence, they can focus on what's going on in the population and what would the benefit be. I think that the answer would be really easy. What's happening here is that these practices are being used for many years. They're still using it, and they're still going to use it independently for what the government says, or whatever the government Ministry of Health says. And this has happened, it will continue happening because people need it, because people see that there's a benefit, because if not, they wouldn't use it, and because they won't need to spend amounts of money, because if not, they will also do it. So this type of aspects make people to look for this type of practices, and probably it's something that makes more sense to them, because if not, they wouldn't look for them as well. Now I'm a doctor, and I can also understand, and I can be concerned about the risk that maybe there's somebody that's taking advantage of people, maybe somebody giving herbs to people that are going to harm them, maybe somebody that is giving or providing treatment is not the most ideal one. Yeah, that might be the case, but if I want to really solve that problem from the comprehension of reality, and when I uh, talk about what the citizenship is going through and what they're looking for, well, I'm going to look for a way of providing a response to that without coming into demands like Icelandia was saying about demanding evidences that are not or practically impossible for financing that complementary medicine has, and due to the philosophy that it has. So if I want to give an answer as such, I need to look for a way of generating evidence, real research through universities, through professionals of health. But I need to make that an intention. I cannot continue saying, no, this is not good, because I believe that the greatest risk of complementary medicine is it happens when conventional medicine furthers from it, leaving the population completely alone and abandoned in this search, instead of being able to direct it and for them to consult with the professionals about a more precise information regarding of these matters. What we need to do is to keep on looking at this. It's complicated because I was taught for therapy, somebody that is not a health professional, and I'm a floral therapist. I cannot say, well, floral therapy can only be done by professionals of health. I cannot say that. That would be really unfair for people that have taught us that practice, right? But I can say, well, how do you think the training should be? How much you study? What are you studying? How to certify it? So there needs to be any type of preparation and all of this type of things. But what we need to focus on, and this is not, or if we keep on taking these professionals of health out of this reality, that or they don't want to see this reality, the distance is going to be more and more. So we need to work on universities of health, showing this diversity in the culture and showing this diversity in this medical pluralism that deserves the respect, uh, because we deserve a piece of a whole pie that medicine is. Our view is not the only one, and in that sense, we need uh, to look at that aspect. And if it's up of our interest for the safety of the people, then we need to approach complementary medicine. Then that's my view, my vision, and I think that we can work, we can generate evidence on this. I believe that at least what I've heard today and from my country, we have a huge amount of people with complementary medicine that if we could organize it, we could publish it, and we could publish a lot more experiences. We don't do it because generally those that offer these type of practices don't have this type of training, but maybe health professionals, we should take care of that. And in regards of the question that I was asked in the chat, but I don't remember anymore, I'm sorry. It was about the advancement in Chile towards integrative medicine and beyond complementary practices that are managed nowadays in the public system, but separately. Well, yeah, we've worked a little bit under that line, thinking that the integrative medicine concept with its definition and its functions and what characterizes it could maybe be integrated easier within the establishments of health. So in that sense, yeah, we have worked a little bit into strengthening integrative medicine, and we've tried to teach it at some universities, for example, the Chile University, Católica University, Santiago de Valparaíso, Chile, Finisterra. In Conception as well, there are some university, and we have also been promoting this type of teaching or training in professionals of health. Under that sense, we were lucky We were lucky for projects to be accepted for hospitals in Chile to come with an integrative medical unit. That's why those pictures of Puerto Varas Hospital and there's a hospital in Conchagui in the northern area of Santiago, and they have integrative medicine medical units. We have one for San Fernando, which are different cities in my country. And we need to be really careful here because once we have this integrative unit, what are the professionals that we are going to have? Do we have professionals for that or not? There's a gap there that we also need to be responsible enough to cover. So good questions, good comments, because yeah, those are the high points. Because philosophically, you can see, oh, this is really nice, and honestly, I do. I find it to be wonderful, but the reality, the most concrete thing, we need to look at the training of professionals. How can we generate evidence? Evidently, those are important factors. In the chat, I also saw comments, and I just saw them really fast because, or regarding traditional medicine in my country, because I wasn't talking specifically to that today, not because I'm not interested in it, but because Margarita Saez talked about that last Saturday or last Sunday. And in Chile, we have different decrees for traditional medicine and for complementary medicine that still doesn't have a regulation. Somehow, traditional medicine in Chile is still protected and could be done, and we can purchase this medication and we can get it uh, on with no restriction because it's acknowledged in our new nine and originary population. So my huge respect to them. I didn't mention them in my lecture of today because as we spoke in traditional medicine last Sunday, I was only talking about complementary medicine.
Yolanda, eu gostaria de complementar uma pergunta
I would
do
like to complement the question. Out of that discussion, yeah, it's been a discussion, a dispute of the narrative about what to complement. This is the discussion that people are going to need. And for example, these are simple discussions. In Brazil, we have a difference in original populations, and each one of them has a way of caring for themselves. So I don't feel authorized to do this type of things policy-wise, but we do need the space for people to learn. So what are we doing regarding the reservoir and the line of spaces in Brazil that we are opening to unite traditional population to have a way of protecting this sacred knowledge? We need to learn these methods of ancestry health to better our own. As we said before, uh, we need to be able to be open to work with different cultures and different methods and ways. That's why we are lean to we work with what works in our own culture, and sometimes we see each other in a paradigm to heal each other with plants. It's something that some people are used to and then affects culture at the end of the day. And there's still a lot of things to learn from Africa that has a lot of traditional medicine because of many reasons that's practiced even in or with the advance in biomedicine. This is going to represent an important movement in this field in all of the concept of public health. That's why we need to learn off of these phases and to learn how to work with complementary medicine. Doctor, thank you very much for your responses. Of course, it's really enriching to be able to hear to each one of your experiences, especially in our case that we're still making public policies to be able to reach these first steps in articulation in the case of Ministry of Health and strengthening as well from on points experiences from different systems like the systems health experiences that help us and serve as an experience to keep on moving forward in the framework of integration of therapy and complementary medicine and integrative in our country. And also, it's nice to have this discussion in the framework of our bicentennial. So thank you very much again. I appreciate Dr. Monica's help. Dr. Islandia, thank you very much for this today's discussion. To our listeners, and thank you very much on my side to the organization, to the Paramedic School of Peru for the invite, and we'll be seeing each other at other point and other opportunity. Thank you very much for that. And I'm sorry, we do have our following panel. Our
live.
Hi again. Welcome, everybody. I'm going to speak in English because our next panel, and this is the last panel, we are honored to have English speakers. So I will, for facilitating the work of translators, I will speak in English. So this has been a great day. We are just approaching to the end of the day, and I'm honored to present the last panel, and it is about experiences of health services in integrative medicine, and it is about, we're going to share some experience. We are not available, it's not feasible to present. We want to present more, but we're going to present two great experience, and we're going to share, we're going to exchange how they made their organization and management of this integration and implementation of integrative medicine. So at the end of the panel, we are going to be able to ask some questions to Dr. Lopez. Our first presentation, it's a pre-recording for made for this second summit. And I'm honored also to present Dr. Darshan Mehta. He is the Director of Education of the Osher Center for Integrative Medicine at the Medical School of Harvard University and Brigham and Women's Hospital at the USA. He is a medical doctor from the School of Medicine of Texas Southwestern University. And he's an academic of Harvard University and researcher in curricular development of TCIM. He has a great experience in implementation in different services in Boston. And also he has a great experience in teaching and training in medical school. And then we have also the honor to share the experience of Dr. Gabriel Lopez. He is the director of the Center for Integrative Medicine at MD Anderson Center, Cancer Center in USA, in Texas. Dr. Lopez is an assistant professor and medical director of the Integrative Medicine, as I said, in MD Anderson Cancer Center. And he also he has shared all of his experience in many centers here in South America for implementing of the integrative oncology care in our countries. So he's also a great friend of our network. So as I said, finishing this panel, we are going to be able to ask some questions to Dr. Lopez. So welcome for all of your questions.
My name is Darshan Mehta. I'm the medical director of the Benson Henry Institute for Mind Body Medicine at Massachusetts General Hospital and education director for the Osher Center for Integrative Medicine at Brigham and Women's Hospital. And I'm a faculty member at Harvard Medical School. Just want to take a moment to thank the conference organizers for inviting me to present at this international summit. And so what I hope to cover during this talk is, number one, to understand the role of mind-body medicine in primary and specialty care practice. We'll take a brief moment to review the epigenetic and physiologic basis of mind-body medicine that supports the health outcomes that we are observing. And finally, we will learn how best to practice and deliver mind-body medicine in ambulatory, inpatient, and virtual settings. And we'll take a few minutes at the end to do a brief experiential activity as well. What is remarkable about the field of mind-body medicine in the present day is this is where we have arrived. I'm learning how to relax, doctor, but I want to relax better and faster. I want to be on the cutting edge of relaxation. It is important to continue to recognize that non-communicable diseases are the most important global health challenge of the 21st century in terms of disease burden and mortality. And this fact remains true even despite the current COVID pandemic we are in. while there may be this temporary occurrence where there is a communicable disease that is really a tremendous global health challenge, even those that are most afflicted, for example, those with conditions like cancer, diabetes, hypertension, coronary artery disease, those with or come from spaces of increased psychosocial stress, individuals from marginalized communities or communities of color that suffer greater than other populations. They are the ones who are most afflicted by the COVID pandemic. And so what we are noticing is that even those that are affected by communicable disease, the underlying factors that affect them the most are the ones that are the non-communicable diseases. As we think about what the stress response is, this figure by Dr. Bruce McEwen really illustrates what we are getting to the heart of, and that is the development of allostatic load. This is really looking at the cumulative effects of stress over the course of lifetime. And there are several factors that contribute to this. First is our individual differences, which is comprised of our genes, the way we were raised, our experiences in life. There's perceived stress, our sense of threat, helplessness, and vigilance. And then there are the behavioral responses. This is the fight or flight response. These are behaviors like diet, smoking, drinking, exercise. And then depending on our environmental stressors, such as where we live, where we work, major life events such as birth of a child, death of a loved one, and then obviously what is now becoming even more and more important of understanding is history of trauma and abuse, leads to contributing to, again, to our sense of perceived stress, which contributes to then our physiologic responses. And allostasis, the ability to adapt between the stress response and then returning back to a normal physiology. But when we lose that adaptation, that happens in the setting of an increased allostatic load. And so what does that mean in terms of stress-related illness? So again, this is another depiction done by George Crusos. And again, we have two common axes that we often think about when we're looking at the stress system. There's the hypothalamic pituitary axis resulting in increased cortisol. That results in decreased growth hormone, IGF-1, changes in thyroid responses. And that can affect various target tissues. And then on the other side, we have the systemic sympathetic adrenomedullary system. We have changes in epinephrine and norepinephrine interleukin 6. These again affect target tissues, resulting in things like, as we saw in the initial case study, metabolic syndrome. That includes increased resistance, visceral obesity, sarcopenia, changes in triglycerides and other lipid profiles. We have also changes in endothelial dysfunction. We have changes in bone density, atherosclerosis, sleep apnea, cardiovascular, neurovascular disease. And again, we begin to see how the stress response can contribute to an overall inflammatory cascade. In the late 1960s and early 1970s, a young cardiologist at Harvard Medical School, Dr. Herbert Benson, was studying hypertension. And in his studies of hypertension, he found that when individuals learn to practice a repetition of a word, sound, prayer, thought, phrase, or muscular activity, and when there was a passive return to the repetition when other thoughts intrude, by breaking the train of everyday thought, there was actually a physiologic effect. And he found these in practices of meditation and other mind-body practices. And benefits were seen in as little as 15 to 20 minutes, 1 to 2 times daily. And as I mentioned, the relaxation response is a state which is elicited by many mind-body practices. These include approaches like meditation, Tai Chi, yoga, imagery work, hypnosis, and it is conceptually opposite of the stress response. And particularly when the stress response is chronically activated, we begin to see negative health outcomes. And so the relaxation response is accompanied by physiologic changes that include decreased heart rate, decreased blood pressure, decreased respiratory rate, and increased exhale nitric oxide. But what began as initial studies in physiology, we're now beginning to see at the level of the genes. And as some of you here already know, it turns out that while our genes may be fixed, the ways in which those genes are turned on and off are modulated. And this is known as gene expression. So it turns out when individuals elicit the relaxation response, we see changes in over 1,500 differentially regulated genes. These are pathways that are seen in inflammation, in insulin utilization, and ATP synthase, and mitochondrial energy production. And again, these were done by studies that emanated from the Benson Henry Institute. And again, when we found that as compared to novices, advanced meditators also demonstrated these changes. These were individuals with 10,000 hours or greater of some mind-body practice. And we found these epigenetic changes similar across multiple meditation traditions and other mind-body practices. But what was even more fascinating is that these novices, when they began to learn mind-body practice, they began to move their genetic expression pathways similar to those of the advanced meditators, and these changes were seen in as little as 8 weeks. These are pathways that are responsible for processes of apoptosis or cellular death, the stress response, as well as inflammation. At the level of neuroscience, we're seeing that the regions of brain affected involve cognition and executive function, emotion regulation, as well as neurotransmitter release. And again, this data is constantly evolving. And as we have improvements in technology and our ability to have increased diagnostic procedures through imaging, through genetic expression, we are learning more and more about what mind-body practices do. Also importantly, I want to make sure that what is clear out there is that up to this point, most of the research has focused on what is common between different mind-body practices. However, I suspect that in time we will also begin to learn more and more about what is different, such that clinicians and other individuals will have the ability to potentially prescribe which mind-body practices are better suited for some individuals versus others. When we look at studies of cardiac rehabilitation, when we include a mind-body component, we actually find that the mortality at 3 years in patients with moderate to severe coronary disease is actually less than patients who undergo traditional cardiac rehabilitation, which is typically comprised of exercise and nutrition. So the addition of a mind-body medicine component actually helps above and beyond, we believe, what is just seen in traditional cardiac rehab. This is important because this has significant implications given that coronary disease is such an important, has such a significant worldwide burden. When looking at mind-body medicine and healthcare utilization, we have found that when people encounter mind-body approaches as a part of their clinical care, there's a reduction in billable encounters. And more importantly, there's actually a reduction of utilization, of, especially amongst high utilizers. Furthermore, this translates approximately to a cost savings of just under 2,400 US dollars per year. There is a significant amount of heterogeneity in the expected range of cost savings, but our studies have shown that there is some signal here to be followed where people are using less medical interventions as a result of encounters with mind-body medicine. At the Benson Henry Institute, we've developed an 8-week program entitled the Stress Management and Resiliency Training Program. And again, similar to other programs, we do believe that resiliency can be built through a 3-tiered process. It's the ongoing practice of techniques which elicit that physiology that counteracts the negative effects of the stress response or the relaxation response. It is about building awareness of stress and its negative effects. It's about promoting social connectedness and healthy lifestyle behaviors. And we've developed an 8-week multimodal program. It's a composite program that incorporates elements of modern psychotherapy with wisdom traditions through mind-body practices. And so I want to just take a brief moment to think about how does this all relate to what we are all dealing with today. So this is a beautiful study done by Dr. Sheldon Cohen, and this is now almost 30 years old. It was published in New England Journal of Medicine. And basically what he did was he took volunteers and isolated them in a hotel room and asked them initially, how much stress are you experiencing? And then with each of the volunteers, they were randomized to a virus that caused the common cold. These included viruses such as the rhinovirus, respiratory syncytial virus, amongst others. And so as you can see from this slide here that there's a pretty amazing relationship between the degree of psychological stress that someone perceives and the percent incidence of cold. And you can tell very clearly from this graph that it is quite linear in relationship. And this study was one of the most groundbreaking studies for the field of mind-body medicine. But now when you look at the study again and you look at the different viruses that they studied, you can see RV stands for rhinovirus, RSV stands for respiratory syncytial virus. The CV is actually a coronavirus. And the individuals with high psychological stress had a much greater incidence of cold versus those that had low psychological stress. And so what does this tell us? This tells us that the way in which we perceive stress may alter our immunologic response to common viruses. And again, this coronavirus is obviously a different strand than what we're experiencing today, but it does present an important hypothesis as well as treatment option as a part of the overall management of individuals who are dealing with the coronavirus. In addition, I just want to briefly show you this slide, that these were individuals who were given the flu vaccine, but they were randomized into 2 groups. One was the control group, and the other one was a group that underwent the mindfulness-based stress reduction program that's developed at University of Massachusetts, originally under the direction of Dr. John Kabat-Zinn. And they found that individuals who went through the MBSR program, the 8-week program, their response to the flu vaccine was much more robust than those who had not done the mind-body program. And so this is also important as we are thinking about the coronavirus and how we are thinking about vaccines and vaccine responses, that again, we can alter the degree to which we respond to a vaccine, which obviously will affect overall health outcomes, especially on a population level. And so when we think about, again, all the responses and different dimensions of responses of meditation and mind-body practices in the immune system, we're looking at practices that affect inflammation through particularly the NF-kappa B transcription activity, as well as C-reactive protein. There's cell-mediated immunity, including, for example, our CD4 plus T cell counts and activity, and biological aging. This has been shown through work done looking at telomerase, and which are chromosomes actually age. So again, in mind-body medicine, there are so many important and fascinating studies that are being done at the present moment, and many hypotheses that can explore why some of these health effects we are seeing, or lack thereof, as well. In summary, I think there is a lot to be excited of. Number one, there is a scientific basis for mind-body medicine. Number two, there is an economic basis for mind-body medicine. And number three, and most importantly, there is a health basis for why mind-body medicine really needs to be part of the overall healthcare system. As an individual person in this field, I feel quite lucky to have been part of this journey thus far. And I feel truly grateful for the number of mentors and leaders who have really paved the way. And I really feel grateful to be with all of you today. And so at this point, I'd like to take any questions. And then depending on the time, hope to engage in a brief mind-body medicine practice, something that you could potentially even just do in your day-to-day clinic. Thank you again. And thank you again to the Marcus Institute of Integrative Health for inviting me to be with all of you today.
Thank you. Thank you so much, Dr. Mehta. We are really honored to count with you in this summit. Your experience is so vast and profound. So we really appreciate and we are grateful for having you here. So I hope you're not tired. It's Friday, almost night here in Chile. And for preparing the next speaker, Dr. Gabriel Lopez, I'm going to refresh your memory about him. He's the director at MD Anderson Cancer Center's a palliative care physician also, and an internal medicine specialist. As I told you before, he's a great friend of our of our countries, because he has helped us also for implementing integrative oncology in many settings here in Chile, in Brazil, and other countries. So he's very generous with all his knowledge. And we are going to have him here for answering all of our questions. So please send us at the chat, at the YouTube chat, and we're going to send all the questions to him. So I don't know if the video is already okay.
Good day. My name is Dr. Gabriel Lopez. I am Medical Director of the Integrative Medicine Center in the Department of Palliative Rehabilitation and Integrative Medicine at MD Anderson Cancer Center. I'm going to be presenting today on integrative oncology clinical practice implementation, our experience at MD Anderson. Thank you very much for this invitation. I have no conflict of interest to disclose. As an introduction to our integrative medicine program, we have three main components: clinical services, research, and education. Our clinical services include inpatient and outpatient consultations. Our services are available at the main hospital campus, at our MD Anderson satellite hospital locations, and recently, due to the COVID-19 pandemic, we have also expanded our clinical services to the area of telehealth. Our emphasis is on using a coordinated approach, using evidence, clinical care pathways to develop an integrative oncology care plan for our patients. Research includes both clinical research and basic science research, with our clinical research focusing on patient-reported outcomes. Every patient that is seen in our clinical center participates in our registry protocol, which allows us to learn from each and every one of our patient interactions, whether it is from the first consult with the physician to the interactions that our patients will have with our therapists, such as massage and acupuncture. Another important part of our program is education. We have a biannual workshop for health providers that are interested in establishing integrative oncology programs. We have a monthly lecture series, electives, and observerships. Today, I'm going to be focusing on our integrative oncology clinical services, and at the core of our clinical service is our biopsychosocial model, where the integrative oncology consultation serves as the core when the discussion happens with patients as far as discovering how we can help support their health during and after their cancer care in the areas of mind-body, physical health, and social health. All of our programs are directed at helping to support patients in these multiple aspects of their health, with the goal of helping them to achieve optimal health and healing. As far as our clinical center team, we have both our clinical team and administrative team, both critical components to allow integrative oncology to be a successful ongoing service at our hospital. Our clinical team includes 3 physicians, 2 advanced practice providers, 2 health psychologists, massage therapists, acupuncturist, a dietitian, physical therapist, yoga therapist, and music therapist. And our administrative team includes an executive director, center medical director, as well as our nursing team. Our outpatient clinical services include the physician, integrative oncology consultation, our health psychology, nutrition, physical therapy, exercise counseling, and music therapy consultations. And right now, due to the pandemic, all of these consultations are actually available to patients virtually via telehealth, via video, using a Zoom-based platform. Our in-person clinical services right now include oncology acupuncture and oncology massage. And we have ongoing efforts to emphasize the importance of care coordination as we look to expand these clinical services outside of our main hospital into what are referred to as Houston area location hospitals, where we can improve patient experience by increasing their access to these integrative oncology services. These Houston area locations are closer to patients' homes, so they do not have to drive into the main medical center, which is where our main campus is in the Texas Medical Center. An important part of our clinical services is also to provide education to patients so that they can learn more about what is integrative medicine in distinction from complementary, alternative medicine, and how specifically integrative medicine has a role in cancer care. We've developed patient education handouts in areas of nutrition, oncology massage, music therapy, and topics such as probiotics and prebiotics that patients are frequently asking about and trying to learn about how these different kinds of interventions can help support their health. We also offer a number of outpatient group classes. Right now, all these group classes are available virtually. Our virtual-only group classes are yoga, tai chi, qigong. We have a class led by our music therapist, another cooking class led by our dietitian, an art collage studio led by an artist at MD Anderson, and we also have an expressive writing and journaling support group. During the pandemic, we have temporarily closed, but will hopefully soon reopen our lifestyle weight management programs called I Am Healthy and I Am Fit, which are directed at patients either in active treatment or in survivorship, interested in working on their lifestyle behavior modification weight management goals. An important communication tool, both to help patients learn more about integrative medicine, but also for providers, both at MD Anderson and the community, to learn more about what we offer, is our Inside Integrative Medicine newsletter, which we publish monthly, highlighting important topics in the area of integrative oncology. This newsletter not only highlights a topic of the month, but also provides information about the group programs that we offer, also provides information about the individual services that we have as part of our clinic. These group classes, for example, are available for both patients and their caregivers. This is an outline summary in the newsletter about the different services that we offer. And it is really the integrative oncology consultation with the physician that will help patients understand how, when, and which one of these clinical services are appropriate to help them achieve their health goals. As far as the different clinical services, nutrition and exercise are an important part of maintaining a healthy lifestyle during and after treatment. When a patient needs nutrition counseling, we will consider connecting them with our dietitian, discussing a plant-based whole food approach based on the American Institute for Cancer Research nutrition recommendations. For exercise counseling, we have our physical therapist that provides an exercise prescription for patients, helping them with maintaining physical conditioning, also helping with symptoms such as cancer-related fatigue, also thinking about exercise as something that can be done safely, depending on any modifications that might be needed. For example, if someone has had a recent surgery or has metastatic disease. We follow American College of Sports Medicine guidelines when it comes to an exercise prescription for our patients. Our health psychologists are an important part of supporting patients in the area of lifestyle behavior management, especially in the area of weight management and lifestyle change. Our health psychologists will work collaboratively with other members of our team, for example, our dietitian and our physical therapist, to help patients meet their lifestyle modification goals. They will also help patients on their emotional journey through cancer treatment, helping them with areas of anxiety, depression, insomnia, and how these might be affecting their overall health and well-being. Our music therapist can help patients with anxiety and stress, helping to improve areas of quality of life, helping to create social connections. And our music therapist is available to patients in group classes, in a one-on-one outpatient consultation, and also is able to work with our inpatients when they are hospitalized. Oncology massage, we offer recognizing the importance of adapting massage technique to be safe for patients that are receiving cancer treatment. The massage technique that is part of oncology massage is Swedish massage. There is mounting evidence regarding the benefits of oncology massage for cancer patients, and we guide our recommendations about massage based on these evidence, based on the mounting evidence. And so we know that it can help with anxiety and stress, it can help with pain relief, constipation, relief for neuropathy, and also helping with cancer-related fatigue. Oncology acupuncture is acupuncture modified to be safe for individuals receiving cancer treatment. Again, with mounting research, we can help patients understand when and how acupuncture can help them manage symptoms such as pain, nausea, dry mouth, hot flashes, fatigue, neuropathy, and insomnia. Mind-body practices also have an increasing amount of evidence to support their benefits for individuals going through cancer treatment. Benefits can include reducing stress and anxiety, improving overall quality of life, also helping with insomnia and fatigue. Our availability to patients of mind-body practices include individual yoga meditation counseling, as well as group classes in yoga, tai chi, qigong. Our yoga therapist is also available for counseling one-on-one to our inpatients, so hospitalized patients, not just in the outpatient setting. The integrative oncology physician consultation, as I mentioned, is at the core of helping patients to develop a integrative care plan. The physician consultations can happen both inpatient and outpatient. They do require referrals from other health providers within MD Anderson. We do not accept consultations from outside of our hospital, only from health providers within MD Anderson. Again, our goal is the development of a person-focused, evidence-informed integrative care plan. We work as part of an integrated interdisciplinary team, and there's always the importance of ongoing communication with the patient's oncology care team as well as primary physician. I mentioned earlier about the importance of patient-reported outcomes as part of our clinical research. We have our Integrative Oncology Patient-Reported Outcomes project, which allows for ongoing assessment of patients receiving clinical services in our program. This data is collected electronically, becomes part of the medical record, and as I show in this image, is presented to our providers in the form of a report that they can review at the time of their clinical interaction with the patient and help use it to both help guide treatment and counseling at the time of their encounter, but can also help us to see change over time when it comes to patient-reported outcomes. We've explored the data collected, and here I wanted to share that with our integrative oncology physician consultations, we've learned that the majority of patients that we see are women with a diagnosis of breast cancer, about 1/3 with advanced metastatic cancer. And the main areas of interest based on what we've captured through patient-reported outcomes are areas of developing an integrative holistic approach, questions about herbs and supplements, as well as questions about diet and nutrition. When formulating the patient's integrative care plan, it is important to think about a model of how to make this plan incorporate different elements of a patient's health. So looking at areas of lifestyle management, counseling on area of the herb and supplement consultation, but also thinking about integrative medicine as an important component of helping patients with symptom control. In this diagram, published in the Journal of Integrative Oncology, in the Journal of Oncology Practice, we see examples of guidelines, recommendations based on publications to help with specific symptoms. And this kind of data can help drive decision-making in integrative oncology care. We also look to the National Comprehensive Cancer Network guidelines. Here I show specifically guidelines for cancer-related fatigue that include physical activity, yoga, massage, and psychoeducational therapy. Cognitive behavioral therapy as Category 1 recommendations to help with cancer-related fatigue in patients on active treatment, and then Category 2A recommendations including nutrition, sleep hygiene, and light therapy, areas which can be an important part of the discussion with patients as part of their integrative oncology consultation. When we talk to patients about their integrative care plan, we use this visual model to help them to understand how these different aspects of their health interact with each other. And so the areas of diet, exercise, stress, sleep, and symptoms are all interrelated. For example, if someone is not sleeping well, they will handle stress less well, will most likely be less motivated, have less energy to exercise, and if they're not sleeping well, will likely make less desirable choices as far as their nutrition. And if they're not sleeping well, that can contribute to symptoms such as fatigue. So we explore these relationships between these different health areas and then help guide the integrative care plan in a coordinated way using evidence to help patients address these interconnected health areas. As an example of a patient that we would see, we have a 45-year-old woman, obese, with a body mass index of 35. She shares that she does not eat well when she is stressed. She was recommended to start an exercise program. She is worried about a recurrence of her breast cancer. Friends and family have told her to take supplements such as Essiac to help reduce her risk of breast cancer recurrence. And she has started having hot flashes while on tamoxifen as part of her adjuvant hormonal therapy for management of her history of breast cancer. So really the main areas that we would identify as health areas to address as part of integrative oncology would be obesity and activity, helping with stress and anxiety, and then exploring approaches to help with hot flashes secondary to her tamoxifen therapy. If we put everything together as part of that visual model, the integrative oncology care plan, we would think about diet as related to obesity, exercise and inactivity, mood and stress, specifically anxiety, and then symptoms of hot flashes. And we can address each one of those areas by both education at the time of the consultation and also consideration of, for example, in the area of nutrition, recommending patients connect with a dietitian. For exercise, receive specific exercise counseling, an exercise prescription by our physical therapist. To help with anxiety, our patient can consider yoga, massage therapy, meditation, perhaps also a health psychology referral to help with not just anxiety, but also to help with lifestyle behavior modification goals. And then for hot flashes, think about non-pharmacologic approaches such as oncology acupuncture to help with relief of her tamoxifen-related hot flash symptoms. So integrative medicine, when is the right time? Really at any time. Integrative medicine can be a part of an individual's health and cancer care, from anywhere from prevention, active treatment, into advanced cancer or survivorship. It's just a matter of looking to the evidence to help drive the decision-making of how these interventions will be most appropriate to support the patient's health. So in conclusion, when we think about integrative oncology clinical programs, there are definitely important components to a successful program. Integrative oncology programs can serve a key role in education, clinical care, and supporting high-quality research. The more education, the more awareness by other health providers of the benefits of integrative medicine for their patients, and they're more likely to then trust and make the referrals into integrative medicine to help support their patient needs. And high-quality research can help to further provide evidence needed to guide these decision-making processes as far as which interventions are most appropriate for patients at different times and with different with different presenting symptoms. Patient-reported outcome assessments are an important way to enhance care, and they're a very effective way to enhance the existing evidence for integrative oncology interventions. Using an evidence-informed approach is important so as to distinguish integrative medicine in cancer care from alternative medicine. And then also important to think about financial accessibility. And depending on where we are in the world, there can be different amounts of resources available for patients. And we want to think about how we can not only know which interventions can help patients, but can also make them accessible to our patients, whether it's from financially or distance. And so I think that thinking about virtual models of care for delivery of integrative oncology is something important to consider. Integration and sustainability of clinical services is important. It is important for integrative oncology to be not just something that is on the side. It is something important for it to be integrated and part of cancer care workflows. So it is something that is clearly made available to patients when they need it, not an afterthought. And it also is important to work collaboratively with oncology care teams so that it's part of a multidisciplinary approach. Integrative medicine is not something that happens independent of cancer care, but something that can be truly integrated and help serve our patient needs, and can also help oncology care teams be more successful with taking care of their patients' symptoms and hopefully resulting in improved cancer care outcomes. So thank you very much for the opportunity to present, and I hope to have an opportunity shortly to answer your questions as well. Thank you.
Thank you so much, Dr. Lopez, for your presentation, your comprehensive presentation. Once again, you have helped us so much with your vision of implementing integrative oncology in different settings. So we have some questions, but we think that Dr. Lopez have some problems with his connection. So we sorry again, we have the questions that you made at the YouTube channel at the chat, and we have them. We're going to take note, and then when when Dr. Lopez said he's okay with his connection, we're going to answer these questions in the same chat of the YouTube chat. So we're sorry about that. We ask your comprehension. It's things about connection. But that's, we have more time for questions for the next panel, for the next conferences of Dr. Soriano and Dr. Parker, that they're going to be with us in few minutes more. So please, Rocio, Nati, let me know if we're going to go on right now, or we're going to make a little pause. We're going to do a pause, I say, 1 minute pause, so you can go for a tea. Hola, ya
Hello.
estamos en
We're in our last two lectures with two great lecturers, great friends too. We thank you very much for following us. And there are people who have been along the 3 days last weekend, and on this fourth day, they have been together with us in all of the schedule, and you have followed the summit very rigorously. Thank you very much. We have prepared this space with lots of love and with lots of effort because we think it's an important contribution to integrate and articulate MTCIs with all, TCIMs with all their contributions and everything that they mean. The following lecture
se titula Explorando los vínculos entre soberanía
refers to exploring the links between food sovereignty, environmental health, and people's health. And we have Dr. Scarlett Soriano who will be speaking about this. She's a great reference and a very active member and a leader of the Academy of Integrative Health and Medicine in the United States, and also from the Consortium of Integrative Medicine. She also participates there in the United States. She is a family doctor, and she's a great leader concerning equity and well-being in health. It's an honor, Scarlett, to introduce you. Are you there? Thank you very much, Cecilia. Yes, I'm here. Lots of love, lots of respect and admiration for you. It's been an honor to connect concerning the preparation of this summit. Thank you very much to you all for making the decision to be present in this conversation, which is such an important conversation that takes so many dialogues up about how we can reimagine what is possible for our diverse communities that are at the same time so very much linked in our humankind in a single planet. I'd like to contribute with some thoughts tonight. I'd like to talk a little bit about how to integrate access to food that is really nutritional and affordable for people in different segments of our communities, in different social classes, genders, ethnic groups, races, and how we integrate the environment's health, our Mother Earth's health, in a policy that encompasses and integrates traditional and complementary medicine towards truly integrative medicine. This is a huge conversation. So today we're only going to touch upon a few things, but I think it's a good idea to talk about this. This topic has come up in many of the talks we have seen. I'd like to contribute to this dialogue because I think we have a unique opportunity at several levels. I'd like to start by emphasizing the critical condition of our planet right now. The 2020 report of the United Nations on meteorology provided us with very significant information that we should integrate in our action plans in all the dialogues and talks we have been experiencing. We know that there are climate fluctuations that we have never seen before in the planet. We know, for example, that countries such as Finland, and we immediately think, oh, cold. I'm from the Dominican Republic, and I think about Finland as cold. This has been the hottest year in their history. We also know that there have been rains that have displaced populations in many regions in the planet. We know, for example, that in Asia, China, Nepal, Bangladesh, particularly Vietnam, they have seen floods that have caused damage and unprecedented damage. We have also seen the opposite, huge drought in many parts of the world, and global warming that has affected many communities all over the planet. Cuba, for example, that made its presentation a little while ago, saw the highest temperature level. It was a record level. Guatemala also had a peak, a temperature peak in 2020. And we also know that the Intergovernmental Panel on Climate Change, the United Nations IPCC established a report in 2018, which led us to stop and think that it's truly the time for uniting our voices in collaboration to create practical actions. In this report, a special report, they talked about the fact that we are directly going to 1.5 Celsius more of global temperature. And they specify that if we don't change, we will reach that level in global temperature between 2030 and 2050, with the very likely possibility of reaching that level in our planet. We thought that just a single degree Celsius would mean a global catastrophe, and we see that we are tending towards 1.5 degrees Celsius, which can have catastrophic implications for the entire planet. One of these, which is essential, is access to food, to healthy food in a regular way, in a way that you can anticipate and that can allow life to flourish for individuals, nations, and regions in our planet. We know that our interaction with our Mother Earth is fundamental for our existence, and that takes many aspects, but one of the main ones is the capacity to provide our body, our cells, all the systems that are coordinated to maintain our human life, and of course all forms of life require food. There is a storm, excuse me, it's like Mother Earth exclaiming. If you can hear these thunderbolts, it's because if you hear thunder, it's because there's a storm outside. So these aspects concerning environmental degradation that is no longer hidden, it's very clear, and the deep impact of climate change effects and other aspects of our life in access to healthy food for regions, not only for individuals, but for entire regions in the world, has to be a main foundation of any policy we have towards integrating traditional and complementary medicine in our systems that tend to be biomedical. There's a special strength in many of our systems, in our traditional and complementary systems, particularly regarding this aspect, where many of our indigenous communities and cultures, generally speaking, have kept knowledge regarding that critical connection between Mother Earth and human life to safeguard health. Ayurveda, for example, which is one of the oldest systems coming from India. I don't know Sanskrit, but I love the original definition in the original texts of Ayurveda. They state that a healthy person has to prepare. It's not only nutrition for all of its tissues and bringing out waste of your body and having a full spirit and mind to be called healthy person. There's knowledge in many of our traditional medicines, like the Chinese medicine, medicine in the Americas, in many regions of the world. They already have an understanding of the intimate relationship between our survival and the planet's survival. The difficulty is in separating and forgetting this knowledge, which is critical and that perhaps have been seen as outdated in the boost of our, or in the boom of our technocracy, and because we have fallen in love with our green revolution that started in the United States, revolutionizing seeds, pesticides based on oil, fertilizers based on synthetic products, particularly after the Second World War. We have seen a disconnection between these very important kinds of knowledge and the policies, structures, and concepts that have shaped up much of our society, particularly our farming, how we feed and how we treat the environment, how we relate with this body we are part of. I think we have a huge opportunity of recognizing what we are again, what we mean, and establishing new policies and concepts that will help us create a new map, a new route that will integrate traditional and complementary medicine. We have this need of making a call to these voices, to this understanding that will allow us to integrate the best we understand in technology and the best we understand in the very old history of our relationship with Mother Earth. It's important that pluralism in knowledge becomes a slogan, something that sustains us and helps us to create a new reality. The 2020 experiences with the coronavirus pandemic, the SARS-CoV-2 pandemic, have been very important for us because they have helped us to understand that there's a limit after which we cannot hide what's happening underneath or behind, or what's happening in some places where they have less access to a voice. We have seen that we are one, that the health of our soil, our forests, our air, our water extraordinarily impact the capacity to survive of all the human family. And at the same time, ironically, we can see that the impact on healthy food, on nutritious food is not only central, but that it has two extremes that lead us to negative effects in our health. We know that malnutrition or the malnutrition condition deeply impacts the human body's ability to create the conditions that will bring health to us. We know that if we don't have the necessary elements like magnesium, zinc, basic things, magnesium is used in 300 different reactions in our body. Lots of what has to do with our brain work, the immunological system, the essential system for immunology, for our immunological system. But we know that the magnesium levels in many places in the earth are very low. And we know that malnutrition deeply impacts our capacity to sustain health. The essential synthesis for our immunological system, we know that the capacity of our microbiota, of our bacteria that help us to keep healthy, well, for doing this work, these bacteria are very much related to soil health. There are many pesticides that impact our pathway that bacteria use to create amino acids, and that impacts our intestinal flora and deeply impacts our immunological system. All of this is established, and there's much science behind all these things. And we know that overnutrition or overfeeding with low nutrition is another kind of malnutrition, lots of calories and little true nurturing, and that impacts our capacity to sustain life. We see that there are communities where obesity is high, but malnutrition is always high. Poor communities in several regions, particularly in countries and regions that are quite wealthy in the planet, we see high obesity, low nutrition levels, and they have immunological malfunctioning. The coronavirus pandemic made us realize this very deeply. In the United States, where I live, we saw that obese people had a much higher risk of becoming sick and having complications with the virus as compared to people who had a more normal weight. We know that any inequality and the disconnection of the fundamental links that unite us to the planet have a lot to do with our capacity to sustain life and beyond of flourishing in this planet. What I think is that we have a unique moment in our history in that our capacity of moving beyond platitudes, beyond conversations, to action, strategic action projects that will clearly relate us with a determined policy, with a kind of definition we need in emergency moments, with a kind of understanding that happens when we open our eyes. We're in the Titanic and we are all going to die. That's what we need right now, to create the links that will allow us to establish truly intersectoral action agendas that are interprofessional and encompassing of the kinds of knowledge that we have in the planet and that we all need, because we are all one. We are diverse and one. In our links with the earth help us remember this. I hope that because of this conversation, because of the talks we have had, all the presentations that join us and or unite us and help us understand the wealth we have in our traditional and complementary medicines, we will be able to create a global movement. We can create a conversation based upon all these concepts, but fundamentally practical. Through it, we will be able to exchange best practices, as we say in English. The experiences we know work with determination that will help us to overcome the challenges we've had to implement this kind of integration in the past. There are many examples. There are organizations all over the world, particularly in the civil society, who are already doing this work. We don't have to reinvent the wheel, as we say in English. We have a lot that already exists, like the creation of community gardens or personal gardens, creating bridges between old knowledge and new generations, establishing incentives of different kinds in terms of the healthcare systems, health coverage, economic incentives, educational incentives, so that new generations and the population at large can reconnect with the earth, use what is best in technology with our old knowledge to implement, or ancient knowledge to connect rural and urban people with access to earth and healthy food that is dense in nutrition. We already have models for that, and we can start to escalate them at higher levels, at provincial, country, and regional level, conserving other actions. For example, one action is to create true incentives for the creation of personal gardens and for gardens in the daily lives of people, gardens in hospitals, gardens in preschool education, where grandparents and children connect on earth aspects, where products are from those gardens are incorporated to the food of a hospital or the children in a school or people in other institutions like jails, for example. We need to expand this. People need to be connected with the earth and receive that nutrition. Also, keeping seeds. Dr. Vandana Shiva is an expert and who has become a world expert in the movement for protecting both democracy and soil, and also the sovereignty of many communities. Her work started with the problems she saw in India, where she is from, when hundreds of people started to commit suicide because they had found genetically modified seeds that would no longer reproduce, and they were indebted, and they started a movement called 9 Seeds. Through her work for many years, she has established biodynamic agriculture models. She teaches that the capacity of the earth when it is organically sowed is the same or even higher as compared to being sowed with synthetic fertilizers and pesticides. But all the bioma, all the ecosystem health level is protected at the same time as mental and emotional and physical health of people increase. So another action I would recommend is keeping seeds, moving outside genetic modification of seeds, and keeping our seeds in an artisanal way. We know they have an entire planetary history that can help us, a whole history of resistance, of capacity to sustain climate changes, that many of our seeds, genetically modified seeds, do not have. This doesn't mean that we will never use genetically modified seeds, but we need to have a lot of regulation for this kind of agriculture, and have national and regional determinations regarding preservation of what has already existed for thousands of years. Another action is cooperatives. Joining equity and new concepts or very old concepts that we are acknowledging again to create a better distribution of resources.
When uniting the ideas of the cooperative and of the self over superation and the self-improvement of women and the relations with special abilities within this policy of integration with earth is a huge opportunity that exists already, and we already have models through which we can learn and we can establish and make it more specific for our regions. There's many examples throughout the world where we've seen that we can recover this harmony with earth. We can recover the sustainable nutrition, and in harmony we can recover health at the level not just of the individual but also at the level of the sense of union of group, and as a group union with the earth. my recommendation for all of us will be to work on these projects, to think of conversations after this summit finishes that would allow us to look between the huge treasure that we have, those pearls that are going to be necessary to help us and to re-envision, to rethink a concept of health that will remind us that our life, it's a whole life, is related to the planet, and the lives of the planet is related to our life in the physical level and in the mental level, in the emotional level, in the spiritual level, in the social level, and as a family that we have in common and that we are in common on earth. I'll stop here, and I hope that this served as a sort of a reflection. I will be more than thrilled to share the reports that I referenced to the organization of the event so they can make it accessible for anyone that needs it. And I'm really, really willing of being a part of these conversations in at the different levels, especially that it's necessary for us to establish the structures that will lead us to the real practice, to the real change. Because with this pandemic that we lived, we know that we need to act and we know that there's a richness in knowledge. Thank you very much. Thank you very much, Scarlett, again. Your words are always deeply inspirational, and somehow they gather everything that we've talked about and everything that more than talked about what we've gathered around in regards of these 4 days. We're about to conclude. We're still two more, but you always inspire us really when, and also in the prepping of this summit, when you mentioned how important it is and to remain focused in our diversity, but also in our unity and how we connected, all of us, all of the creatures that we are and that we are in this planet. We could think even further than that, but maybe it's hard for some people. And how does it influences? And to start with equality in global health, we need to look at generating access to nutrition, to food. The nutrition can also be looked at from an emotional point of view. So thank you very much, Scarlett, again, as usual. You personally inspire me. You've probably inspired us all in the different places that you work and where you give yourself. Scarlett will stay with us. Scarlett will remain with us till the closing of this day. We are in our final conference already. And Dr. Gabriel as well, Dr. Lopez, which is with us, was able to overcome the technical barriers of Friday night. The computer also is tired probably. So I don't know if we have questions for Gabriel and if we leave it for the three upcoming speakers or for the end of our conference. Maybe that's the best thing, right?
Sería este el momento. Ya están ahí en el chat en el chat están las preguntas.
Well, we have the questions already for Scarlett and for Gabriel. Perfect then.
Gabriel.
Gabriel?
Gabriel, hola Gabriel, ¿cómo estás?
Gabriel, how are you doing? Yes.
¿Nos puede escuchar?
Can you hear us?
No estoy segura si
I'm not
Gabriel.
sure if Dr. Lopez can hear us. We can see him, but I'm not certain if he can hear us.
Rosy. No.
Buenas,
Hola.
buenas
Oh,
noches, hola, ¿me oyen
good
bien?
evening. Can you hear me now? We can hear you. Yeah, we did it. Perfect. It's really nice to see you.
Igualmente, aquí sudando, qué pena.
I'm sweating here. Sorry. Don't worry. We're really thankful for the three speakers. We have Tabata, we have Scarlett Soriano. We have you, of course, and Tabata, and we'll add up more because we have questions for you, Gabriel. We thank you enormously for your delivery and your presence here. I know it's been sustained for a long time. There were some questions I don't know if you rather because of translation it's better to do it and to tell them to you right now. You rather than do it in English, in Spanish maybe. Maybe Spanish for the translation because we'll have a mix of that. So one of the question is if from your experience to patients that are already diagnosed with cancer, if the oncologists or different professionals like nurse or any other professional applies any type of screening tools so they can derivate them to the medicine or integrative oncology area.
En este momento no tenemos
Right now, we don't have
una herramienta que usamos para screening.
a tool specifically that we use for screening the way that patients get to our integrative health center is because the team, the oncologic team identifies a patient and the oncologic team of integrative medicine can provide maybe some help if there's a patient, for example, that has problems with symptoms such as neuropathy or dry mouth or heat problems or I don't know, we can start with treatments such as acupuncture that can help with symptoms such as dry mouth, neuropathy, and so on. So that's how we identify the needs. It's more integrated. The system with the support that we provide to our clinic. But I think that's important because there's centers that don't have an integrative program that's established. Ours already have around 20 years. It's well known as a wholesome part of the services that are provided in hospital. Yeah, a tool can be useful for clinic teams to start understanding better what can the wholesome integrative medicine team can provide for their patients in the treatment or when they're already survivors.
Había otra pregunta que
we had another question
relacionada que en algún momento cuando yo también presenté
related
también
maybe at some point I will also ask you about integrative oncology. And I want to ask a question because in the chat that is related.
Es una pregunta que está relacionada con tu quehacer sobre cómo incorporan la espiritualidad desde, bueno, la pregunta en especial era desde el enfoque de cómo se enfocaba la espiritualidad.
Will be more focused to spirituality and can also be spread out to how the spirituality focuses in oncologic integral or integrative care in integrative oncology. I don't know if you can help us by responding to that question in the chat. Well, with a lot of happiness, of course, really happy to. Well, this is really important, and each patient that comes to our clinic center, for example, as a part of the assessment that we do with the patient, where he gets to the Integrative Medicine Center, we ask about the importance of his spirituality as something that if they would like to discuss in their integrative oncologic treatment. Even the Immune System Assessment State or ASA, we use a one that includes spirituality. And I don't know if we can probably that way measure how much spirituality becomes a factor in the symptoms that the patient has as a part of his experiences.
Cuando el paciente nos habla de espiritualidad, hay
In the treatment of his cancer. So when the patient tells us about his spirituality, we have different ways of helping or aiding the patient from an integrational standpoint. We want to know if his spirituality is in connection with a religion, or if it's a spirituality that's not connected necessarily with a religion or specifically or a faith. This organization way we can lead or guide the patient to certain lines that can help them. We can, for example, connect them with mentors that are also a part of his faith to provide support, or we can talk about maybe meditation, yoga, not necessarily to talk about or to use medication and yoga in a way that is not going to have a conflict with his faith. And that's something that we have in many cases where we have patients that feel that they can't participate in the mind and body in activities such as yoga because they think that they're going to go against their beliefs, against their God. So we try to talk to them about strategies because there's no conflict with their faith. This could be used in a way that can actually be of benefit. And it's not going to get him in trouble with his God. We have a moment, and if it's okay, I would like to say something else regarding the conversation that we just had about planet itself. And it's something that I didn't mention, but we know that's essential. We know that the World Health Organization and many other bodies worldwide have established as a critical area, and that's environmental health in terms of air. We talk, and I made an emphasis today in terms of nutrition, access to nutrition, and the environmental degradation overall, but within that, specifically the change in the climate, we know that air contamination has been established already for many years as one of the biggest, if not the biggest factor affecting a lot of the health of the world. So I would like to put the finger in there because I wasn't able to mention that any longer, but when having conversations about where are we heading and where we're heading after this, and how can we integrate knowledge and these pearls of knowledge that we have within our traditional medicine, like the complementary ones towards an integrative medicine. We have a huge knowledge that we could apply for the protection of air and for decontamination of air. Thank you very much. Thank you, Scarlett, also. Thank you, Gabriel. I would love to carry on and having this conversation, but we are against time. We are a little setback, but I'm also really happy for all of us to be gathered and to see you despite that we are so far away, physically speaking, of course. Then, if you could join us, I understand that we have a lot things to do, especially at this day, time of day. I don't know what time is it where you are, Gabby. It's probably already, it's probably earlier. And I would like to introduce, and again, I have the honor of presenting, introducing Dr. Barbara Parcher, which is going to make will be doing our exposing conference. She also, beyond being a great person, a great woman, a lot of strength, push that has helped us to moving forward a lot in many groups, many people around the world in general in this integration with complementary and traditional medicine. She's the executive director of the Health Academy and Integrative Medicine of the USA.
Médico naturópata.
She's a naturopathic doctor, naturopathic physician, and she's a co-founder of many international organizations related to naturopathy in the USA. Of course, as I was telling you, she's a leader that has taken this, and has worked with it and leading many uh, types of initiatives, even implementation and research, and leading as well investigation processes. So more than anything, to have more time with Debbie, Dr. Parker, please. She's going to take us through, and going to help us to deepen on how to look at what we were saying before, and we were mentioning with Scarlett, the unity, diversity, inclusion, considering the MTCI. Dr. Parker, welcome. Thank you very much. And I would like to thank first off to all of the co-organizers and all the volunteers, as like yourself, Cecilia, Natalia, and all of you, which are achieving this to be successful in this incredible conference, and to all the participants that are you're still here. I know it's still a long day with a lot of incredible presentations. So I feel really thankful and honored to be here. I'm going to share my screen.
¿Se puede mirar?
You see it?
Okay.
Yes.
Bueno, esta presentación está en
Well, this
inglés.
presentation is in English, but I will be doing, I will speak in Spanish. I was thinking that this is really important as a global community to talk about equality of health in integrational health and the perspective from the US that I would like to share with you a little bit of the history of this. I'm a part of an organization that focuses on integrative health and medicine, and we are a global community trying to join and put together a whole integrative medicine movement. So I would like to talk about a little bit of it.
Murder, en español es
The murder.
El asesinato.
Gracias. El asesinato del
The murder of Mr. George Floyd. And this happened in May. May 25th, 2020.
He
wasn't the first. This was on a whole a long queue of different people murdered like this. But maybe due to internet and the way that it was broadcasted to the world, we were able to look and see somebody that was tortured basically by a police officer. this was something that changed a lot of people in the US and in the world. And it was for nothing. And it was for nothing.
Con una moneda de $20 de tal vez.
He got into a place and he wanted to pay with $20 bill, and it looked like it was fake, but
Entonces, este llamó la atención
this action called the attention of the world, and during the COVID lockdown, where nobody was able to leave, people left and went to the streets. People were looking for ways to say, no, not anymore. That's it. We can't accept this anymore. Before going to our next slide or next page, I just would like for us to take a moment to close our eyes. We breathe deeply and we really put George Floyd and his family and everyone that were suffer this way, that were murdered unfairly. And we just like to send love, a lot of love.
Entonces, en muchas personas, seguro ustedes en muchos países han
So many
visto
people, a lot of people in a lot of countries, you've probably seen on the television and the internet about Black Lives Matter movement
diciendo
that
no.
hit the street saying not no more. We have to change this. But again, many people don't know about Black Lives Matter. It started in 2013, actually. This is an old movement. This was not only a last year type of thing. When another young people like Trevor Martin and many others were murdered the same way, they died the same way. But in May of last year, more than 450 protests happened in the US and in 3 continents of the planet. So we had a momentum in history. And it was this sort of momentum where we had the opportunity of helping in a way to change the consciousness, the awareness, and to change the reality that many people in the US and in different places of the world have to stand for this. And we had a moment to say, just as me, like a white woman, said, okay, I'm gonna close my eyes to those things because it doesn't affect me personally. What am I going to do? Am I going to change? Am I going to add myself to this fight somehow? Or am I just going to close my eyes and be blind to it somehow? In the US, we had people in the movement of integrative medicine that were calling the attention to an imperative of justice, of health, for years. Just as here in the alternative in complementary medicine, were 2 leaders in a collaborative in integrative medicine. Were able, Shelley Adler and Maria Chow, they called the attention on how can we and to let us know that we have a critical opportunity to check, to review the broad and formal movement of integrative medicine to include social justice of health as a key mission and take care of the diversity and inclusion as one of our main fundaments.
En mayo del año pasado,
And in May of last year, in June, July, a lot of these organizations in the US,
blog,
you can see the John Wick's blog is a great leader in the community of integrative medicine.
ahí tiene la URL, pero mucho
We have the URN, but many organizations started in a movement in the community of health and medicine. They said, okay, we need to do something. We need to look our own organizations in the health system of the US. And they started a change. They started, because you start from change of a really, really, really important scope of things, and that's how it works for us. Ourselves. We need to start a whole process of reflection, of self-reflection, and change of the institution, of our academy itself. And we need to be leaders. Dr. Veronique Anderson, Dr. Jean Davis Hatcher, Dr. Yvette Miller, Dr. Scarlett Soriano, and Dr. Rachel Carlton Abrams. They were the visionaries to start this task force of the BIPOC community. And then this change went all the way to a permanent committee in our organization. And we started, there we go, and we started to analyze each and one of the aspects of our organization that really we need to change. We need to change our employees, our education, the curriculum, the membership, every aspect to be able to set equity and diversity as a fundamental part of what we do. We made a lot of forums with leaders so we can start this conversation, which is really important. We had to look in the mirror and saying, wow, look at our organization. We have two organizations here that are working together since the 70s. We never had somebody of color in a position of power before. And how not to look at that? Why? Because we didn't have to, because we have privileges. And when we look at the majority of organizations, which are the leaders of this movement, not just in the US, but globally speaking as well, we look at them or we look the same now. As the majority of speakers, of people that are in positions of power, of boards, and they're all white. And many times they're white males. So we're not different from any other structure that's based in the white supremacy and colonialism. On that type of structure, we need to change them. We can't move forward with a holistic type of medicine where we can include everyone if we don't do this, if we don't look at that and we don't change that peace of mind at a global level. So this was the first forum in racism in the history of our organizations that we got together to. And it was incredible to see how many people want to start that conversation. And it was a real summon to all of the organizations in this area of integrative health and medicine in the US.
Then I'm going to finish, and then perhaps we'll have some time for conversation. I'm going to invite Scarlett so she addresses a few words if she wants, or you can ask any questions if you want. Well, our future work is really a call to action to all of you, all of our global TCIM community. We have made the commitment to have activities and diversity at every level of our organization. Look at the mirror concerning the structure of our organizations, but also the healthcare systems where we partake. Where in the United States, we have a healthcare system of the country that is very racist. So we have to be leaders in this chain. Until all the voices are acknowledged, elevated, and included in the global BIPOC community. We make this promise of humble service to our diverse global community. And we make this promise until we achieve it. It's not a 1 month or 1 year promise. That will be a big change that we really need to put our hearts and see how we can make sure to do and think all these aspects at every level. At the end of this day, I'd like to say that we will continue this conversation in our October conference, transforming awareness and creating a global movement that is united for traditional health and medicine. We'll continue with several conversations about how we can achieve our promises. Thank you. Scarlett, I don't know if you'd like to say a few words or something. Yes, thank you very much. Thank you. And it's incredible that at the last minute you changed everything from English into Spanish. I know that your presentation was originally in English, and thank you very much, Tabby, for having changed. I'm part of this committee Tabby mentioned. I have the privilege of working with Dr. Parker closely and with all our estimated colleagues that were mentioned and other people in the organization. And I've been able to see firsthand determination. I'm looking for the word instead, or for the word in Spanish now, and the courage that has been necessary to be leaders in this kind of change, because oftentimes notions are so subtle, so difficult to discern. The stereotypes we all carry are so transparent that we live in them, but we require a very intentional process to be able to discern them in ourselves and understand some of the ways in which we contribute to excluding some voices and including only some voices, and valuing different people in different ways, because oftentimes this happens unconsciously. I truly have to appreciate Dr. Parker and compliment her, because she has used the action platform she has to create a voice and an axis through which we can create spaces or forums for fundamental changes in institutions, in the academia of integrative health and medicine, and all of the medicine in the United States. So, Dr. Parker, you're really an inspiration for us all. And you have used the privilege, the voice, the power you have to create opportunities and give a voice to many others. So, really, we are in the face of a giant. And this has been beautiful work. And what I have experienced is that at the initial point, as Dr. Parker mentioned, we have to make a decision. Do I close my eyes, which is the easiest, something that we don't feel as difficult, or will I open my eyes to a reality I don't want to see? And all of us, even those of us with dark skins and who have lots of experiences, do not want to see beyond, because it hurts, because it's difficult, or perhaps you feel that we are barely balancing everything in our lives. But there is a point in time, as what has happened in the United States, and it's a moment that we see all over the world in which we can no longer close our eyes. It's the same thing I was mentioning concerning the Earth's health and our interaction with it. Inequality, injustice, differential valuing people because of their race, because of their ethnic group, because of their region they come from. All these spaces in which we take the other, his or her innate value. We need to heal all this, and there are many ways through which we can unite in clear and concrete action to make changes. For example, one of the things that Tabitha created, and it was essential, was the change of the board of directors of the academia. At the highest leadership level, have color voices get into a broader conversation, because there are notions and understanding that would not be accessible to the board people without those voices inside. We can extend this to many of the topics we are dealing with in this conference: the voices of Native people, the voices of vulnerable populations. It's the same work. We have to ask ourselves who's not here, and how we bring that voice, and how we give the same value to that voice. We have created critical conversations through the internet on several topics regarding discrimination and inequity, concerning Black people, for example, how they are discriminated in health. We also had a critical conversation concerning violence against Asian people, stemming from coronavirus. We had an expert panel talking about that, and opportunities in all fields of the traditional, complementary, and integrative medicine. We wanted them to join their voices on that topic. In this way, we unite not only to promote integrative medicine or traditional and complementary medicine as a field, but also to have a conversation among us about how we have a fairer foundation in the same field. It's like cleaning our own house. So it's a pleasure. We have many beautiful experiences we can share with organizations who are interested in getting to know what we have done. And we are also very ready to learn from you and all the work that many organizations here are making in this field.
Realmente estamos, veía los comentarios, estamos
Well, I
profundamente
was taking a look at the comments, and we're deeply thankful to you for this conversation and for being part of it and being here all together. Well, it's a deeply inspiring conversation. What people perceive, what they feel, and what we have felt along the day close with this conversation that is inspirational, motivational, that moves us. And we have talked about very technical aspects during the day too. One of the things I would also like to mention is that to a certain extent we are all adding up towards a path. We are all walking from our different actions. We are in our activities. We're in different roles in different places. Some of us are in places that are far away from large cities. Others are in large cities, and we all add up to each other. We are building and making progress. I think that we got everything at the same time. This pandemic situation has taken us through a situation where we can very strongly see inequality, discrimination in different places. And what you talk, Scarlett and Tabby, about how we are uniquely connected in our diversity is evident. They're telling me through the chat. Well, I have a short comment. It's a quick comment. I wanted to say thank you to Maita Guatemala in the YouTube for her comments. Something dawned on me when we were practicing. Perhaps we need to think about changing this name, TCIM, and instead of traditional, say ancestral, complementary, and integrative. Because in places we went to, like in Nicaragua in 2017, everybody used ancestral and they didn't use traditional. And perhaps it's more balanced. Then you have on the one hand traditional ancestral and on the other hand complementary and integrative. We should not lose that vision about including our ancestors and the medicine comes from strong traditions. Well, it dawned on me. I don't know which god or goddess or Mother Earth told me so. Thank you, Anita Garamara, for her comments, and up to all of you, really. Yes, thank you, Tabby. And also, if we think about what we have done along the day, we can see the importance of articulating, acknowledging, and visualizing all this knowledge and all the different contributions each one of us has. We have talked a lot about acknowledgement too when we were preparing the summit. It's so important to achieve integration. And the big contribution of primary health care in this articulation and integration. All the healthcare network, but particularly the primary care level that needs to be strengthened. We're not going to say TCIM, we're going to say TACIM now. Well, it's a conversation we'll have in the panel. So all these medicines have a role in the primary care level. I think, well, there's a question here from the YouTube chat. It says a good plan would be to train on ancestral and complementary medicine, but training is very expensive, and that's a limiting factor. It's true. It's very difficult to access this training. Could we have a valid plan at continental level? Do you think it's possible? I don't know what you think. Perhaps other people who are connected to the conversation can say something about this. Excuse me. I think this is a marvelous question. I think that it's possible, like, for example, if the person who's asking is thinking in continental terms and thinking in large regional organizational networks that join funds to provide opportunities. I'm not so sure, but I do believe, and that's something that has come up during the summit, that we have the opportunity of sharing knowledge and resources, focusing on equity. Perhaps we can guide resources to areas that need those resources more, or areas where they have less access to this kind of training. There's a conversation about what kind of training we are talking about, but there are regions with more resources that might have integration networks for the TACIM. How would it be? Yes, TACIM, right? Where resources can move from one region to another, and where different organizations can send more resources where there are less resources. That's very valid and important. We need to talk about that, particularly if we make up global networks for TACIM. Very well, Tabby, I don't know if you'd like to add something more. I think we're at a good moment concerning our schedule. And out of a coincidence, this is a topic that opens tomorrow's topic, which is education and training. Tomorrow, it'll be a day that is totally devoted on education and training of healthcare practitioners, therapists, concerning TACIM. We'll have to put some order in this acronym. So you are invited to be with us tomorrow. We know it's intense. These are very long days, but we think that they are super important to continue making progress in our articulation and in our integration with all this acknowledgement of TCIM contributions. On the other hand, let us remember Tabby's invitation for the October Congress, the Integrative Health and Medicine Academy. It'll be posted in our website. Yeah, and we are very thankful for a marvelous, a wonderful closure. We thank you for all the conversation we had, very inspiring, and all that we have worked and pushed together. Each one of us here, I think, is collaborating with this. So thank you very much. And see you tomorrow. Thank you all. Thank you all. Thank you to the organizers, those that are doing the YouTube work. We are very organized. Thank you very much. Thank you. Thank you very much. Good evening. Good evening. Thank you for being with us till this time.